And accountants who are working, but when these things come up, what I do as a minister or a supervisor, I do try to correct some of them. When I joined, audit queries from Global Fund and other Gavi and all that has reduced. A lot of them have actually reduced, and I'll continue monitoring and make sure that all recommendations from auditors' reports are seriously recommended in the ministry. Honorable Chair, thank you.
Thank you, Mr. Chairman. Mr. Chairman will be counting on his expertise and experience in that regard. The second issue I want to focus on, Mr. Chairman, is the matter relating to the arrangement you put in place at the airport ahead of the reopening of the airport on the 1st of September, what I call the exorbitant $150 charge per antigen test. Can you tell us how the company known as Frontiers Healthcare Services Limited came to be given that contract to carry out the antigen test, and how you also came by the amount of $150?
Thank you, Honorable Chair. Honorable Chair, it will be very difficult for me to answer this particular question. Why? Because there's a presidential task force that is supporting the ministry to do the COVID battle. This particular arrangement was put in place by the task force that reports to the president. Now, they actually did the procurement for the, how do I call it?
Sorry, Chairman, just Minister, whilst you're London, is the Presidential Task Force a procurement entity under Ghana's procurement laws? We need further details, but we're happy to hear you further. Thank you, Chair.
Please, in the midst of the pandemic, I would say this wasn't an anomaly. We had groups that were doing various things, and for the task force to partner with the private sector person to do what we did, knowing very well that the ministry itself didn't have the capacity to do and install the type of equipment they put there, I think was quite normal as an emergency arrangement to have done that.
Chairman, just to take note that we would be requesting the chairman of the Presidential Task Force to be in attendance to give evidence to this committee as a witness to testify to what the minister is submitting before your committee.
Well, that's your suggestion. We can discuss later. Kindly continue, please.
By way of follow-up, are you aware that the company Frontiers Healthcare Services Limited, by registration number from the certificate of incorporation I have here, CS1140922020, was only incorporated on 21st July 2020, a few weeks to the reopening of the airport, and it had no medical laboratory experience? Are you aware?
Honorable Chair, I'm not aware.
Are you also aware that
Honorable Okudzeto Ablakwa, you exceeded your limit by about 6 questions?
Not at all, not at all, Mr. Chairman, not at all. Not at all.
One, Honorable Member, you had about 5 minutes to talk about CVs. I ignored that. Then you have asked 3 questions. Now you've done follow-up. So you've way exceeded your limit.
Mr. Chairman, I conclude on Frontiers. The Fees and Charges Act, you're a senior member of this House, requires that the $150 should have been brought to this House for approval. It wasn't brought to this House. The Health Institutions and Facilities Act 2011, Act 829, requires, under the first schedule, section 11.2, that clinical and biomedical laboratories must be licensed before they operate. When they started operating on the 1st of September, I have obtained the certificate from the Health Institutions, Health Facilities Regulatory Agency, known as HEFRA. They only licensed them on the 3rd of November 2020. So by the time they were operating at the airport, human lives were at stake. They had not been licensed. Minister of Health, are you aware of these clear infractions of our laws?
Honorable Chair, in the pandemic, we had a phrase we were using that we were not in normal times. There were certain things that we had to do and try to rectify as we go forward because of the urgency of what we should do immediately. This licensing was done even on my insistence when I went round to do the checks and find out that this hasn't been done, and I said, no, quickly, let us go and rectify the anomaly before things get worse. So when people are dying and people are flying and people want to visit wives and husbands and they can't go, and we needed to open the airports, and we had to put in place something immediately for them to be able to be screened to try to stop importation of the virus into our country. Honorable Chair, I must admit that some things might have done.
Couldn't Noguchi have done that?
Normal instance, and that is why we have this. Honorable Chair,
thank you. Yes.
He's asking another question. Couldn't Noguchi have done that?
Honorable, I didn't admit that question. Yes. Now I'll move to the. Yes.
No comment.
Yes, Patrick Bama raised his hand. Yes.
Thank you very much, Chairman. Congratulations, Honorable Minister-designate. Honorable Minister, I have in my hands the Public Health Act, and Part 2 deals with vaccination. Recently, the President announced to the country the strategies he has in place to help Ghanaians get vaccinated with this COVID-19 pandemic that we are facing as a country. And Part 2 of the Public Health Act mandates, Honorable Minister, mandates you to appoint other registered medical or veterinary officers and other persons certified by a senior medical officer with the necessary competence, skill, and knowledge to be able to assist a public vaccinator. You have public vaccinations, compulsory vaccinations, vaccination of adults, and what have you. What strategies have you put in place should we procure these vaccines to get Ghanaians prepared and other certified vaccinators in place to be able to go around and administer the vaccines professionally as stipulated under the Public Health Act? Thank you.
Thank you, Honorable Chair. Honorable Chair, I must mention that one thing Ghanaians should be proud of is the fact that we have a very robust expanded immunization program that sits within the Ghana Health Service. It has a structure that reaches everywhere in this country. As I speak, our traditional vaccinations in terms of polios, DPTs, and all that, by WHO assessment, we are doing 95% coverage in our country. So when we started developing the vaccine strategy for COVID vaccinations, we thought it wisely not to reinvent any wheel, but continue to rely on what is good for us. So if you look at the strategy when it's fully completed and confirmed, you will see that we're using Ghana Health Service infrastructure to actually do the vaccinations when COVID comes. We've started training those who are doing vaccinations, especially for even COVID, so that immediately we get a, how do I call it, the stocks we can move in quickly to do our vaccination.
Chair, as a follow-up to that question, I understand that some of these vaccines ought to be stored under certain conditions. Do we have those storage facilities in place, or measures are being put in place to get them? Thank you.
I'm afraid we don't have such ultra-negative cold chain equipment, but we have cold chain equipment that can take some types of the vaccines that we are looking for. The indications we are getting, the first vaccines that we may get to be AstraZeneca, that can be stored in our current or existing cold chain infrastructure to do the work I want to do. One other one that is coming up, Johnson & Johnson, if you're able to even get stocks from that end, that can be stored under normal room temperature, so we might not have so much challenges. We do have limited capacity for those ultra negative cold chain facilities, some limited facility. If you should get some quantities, we can store them in Accra and Kumasi, for example, and use. We don't carry them across the country where we don't have any place of such nature. Thank you.
Chairman, my second question is on our party's manifesto, page 157. The New Patriotic Party, the ruling party, 156 to 157, lists about 13 focal points that government wants to achieve under the second term of the president. And it includes, but not limited to, focusing on telemedicine to enhance health delivery. Can you address us on how you intend to pursue this vision of the president and the party and government? Thank you.
Thank you very much. Honorable Chair, we started working on telemedicine. We have a small committee in Ghana Health Service that is engaging to look at infrastructure and training and what have you to actually get infrastructure to do telemedicine. So there is a program in place to enable us achieve this manifesto pledge, and I believe going forward we'll enhance our activities in there and speed it up and make sure that we're able to position ourselves to do telemedicine.
Thank you. Last question is on the same Public Health Act on advertisement, and I'll tie it in with traditional medicine. We've seen that the FDA has taken steps and has been clamping down on manufacturers of non-certified or licensed products. Some included COA FS and others. What are some of the challenges that you think these traditional health manufacturers of these products are facing, and that you, when approved, could be of help to assist them in this regard? Because I believe it's a big industry that the ministry ought to look at critically. Thank you.
Honorable Chair, if you look at the manifesto, one of the things is try to promote traditional medicine. They have an association, a very large one they call GAFTRAM, and we meet with them quite frequently to try to encourage them to register their products with FDA. To register, there are two things that they need to find out from whatever concoction, whatever medicine you present to them. First of all, the Center for Plant Medicine Research will have to test for toxicity, such that you don't put in organisms or toxins that can cause other diseases to people who take your medicine. Then after that, FDA will certify for safety. And if you go through these two processes, then they give you a license to market your product with a shelf life that will give expiry and all that. So when they register you for this, FDA has got a surveillance unit that goes around the markets to try to check registered products and non-registered products. If they find non-registered products, they will want to take them off shelf and probably even prosecute the culprit who is doing that. If they find that you are selling expired medication, not only traditional medicines, but even the ones imported from elsewhere, right, they will clamp down on you. And that is the way for FDA, and I believe that is happening. And therefore, we wouldn't discriminate against traditional medicine people and the orthodox medicine people. So far as you are doing expired, you are doing products that are not registered, they will clamp you on. We are encouraging them, we are educating them, we are facilitating them to get their offense to FDA and plant medicine research for these particular tests to be done and approved, certified.
Yes, all right. Yes, Honorable Member for Tamale North.
Well, thank you very much, Mr. Chair. I wish to exercise my opportunity of a follow-up of two by starting with the use of one of those, Mr. Chairman, if you will oblige.
The use of what?
The use of one of the two follow-ups that I may have to.
Honorable Member, your follow-up should be after an answer to a question. So go ahead. If an answer requires that you follow up, I will not object to it. Please go ahead.
Mr. Chairman, I thought it relates to an answer given and not an answer given to necessarily my question.
Well, as long as you stay within the agreed rules,
all right,
you're clean.
Thank you. So it relates to a question that the Honorable Samuel Okudzeto-Ablakwa asked, which has to do with the charges at the airport. Mr. Chairman, is a nominee telling this honorable committee and the people of Ghana that as minister responsible for the ministry, because he's a former Minister of Health at the time, because we were in abnormal times, he acted negligently and overlooked infractions of the law and even assisted a company that was fraudulently operating at the Kotoka International Airport, because the minister said...
Honorable Member for Tamale North, can you ask your questions, move out the imputations of crime, and those are not admissible questions. Let's not argue about this any longer. Please ask your question straight. Leave out those imputations.
Okay, I take out fraudulently, but the minister said that it was operating without license at the time, and he assisted the company to get or advise the company that was supposed to have been operating with a license to get a license. Now, is the minister saying that because we're in abnormal times, like I said, he negligently allowed and tolerated and supervised the infractions of our laws, even though we have experienced companies that could have done the job that is being done at the airport, where Ghanaians and other citizens are paying $150, which, by the way, has been said to be exorbitant.
So what's the question?
The question
we have listened to your commentary. Now ask the question.
No, maybe if you had listened carefully, you would have noticed the question. It wasn't just a commentary. Is the minister telling this honorable house? That's how I started. That's a question. Is the minister telling this honorable committee and the people of Ghana that because we were in abnormal times, he acted negligently as Minister of Health and allowed the infractions of law and in some cases, assisted or advised a company that was not operating within the law to go ahead? That's the question, Mr. Chairman. Thank you, with all due respect.
Yes, Honorable Minister, were you negligent in your duties?
Mr. Chairman, my simple answer is no.
Mr. Chairman, the honorable nominee was on radio and said, out of, I believe, frustration or exasperation, that he was tired and that the president is tired and that all those who have been working on the COVID team are tired. Mr. Speaker, based on his admission of being fatigued, how can he convince this committee and the people of Ghana, given the fact that COVID doesn't seem to be showing any signs of going away anytime soon, that he still has the energy to continue as Minister of Energy, given the admission that he's tired? I mean, the Minister of Health, sorry.
What I would say, I'll answer the last bit of his question first. That can I continue doing away? What I would say, I have the privilege of having my wife here. So probably she can assist me answer that question. Ajwa, am I tired?
You're out of order.
Mr. Speaker, sorry, Mr. Chairman, the translation of what I said here is wrong. 100% wrong. I made this admonition at a function in my constituency, Domahinkro, and I spoke in Bruno. So whoever translated it to English got it entirely wrong, and that is not what I meant. Thank you, Mr. Chair.
Is there anything you want to tell us relating to that
Chair,
matter?
Nana May can say? Yes. He's alluding to what I said. Say, Nipa enshe mask. Yaho huyensa. Ye use sanitizer. Na ye adwuma. President na, we are putting money. Ye dia ho de nyile guso. Nipa nso nya ye no montie. Nti yare no enkoda. Does that mean we are tied?
Okay, so translation. Kindly translate that to English.
Which, the emotions, Mr. Chairman.
No,
so you can translate for me. Mr. Chair.
Napo, Chairman has directed.
It's unfortunate that this has come up here, but that was not what I meant. I was trying to tell people that they should have sympathy on those of us who are fighting the battle and listen to the admonitions we were putting into a public domain to adhere and comply with the protocols. That was all. Then a journalist who may not have gone up to a level that he should have reported properly, put this in there. I got the opportunity. Yes, I confronted the man who did that. That why do you misquote me in the language that, I mean, my people wouldn't easily understand? I was talking to the Doma people. And I got opportunity, I didn't say it on radio, maybe let us correct that too. To tell them, when they published this one, I went there to try to deny the matter, that this is not my intention, this is not what I said. And it's unfortunate that my colleague is bringing this matter up here. So I think I've corrected the fact a little bit. I'm not tired. I said you can ask my wife. Obi is your friend.
All right, Mr. Chairman, public officials have a duty to be candid and also to be honest. This is a follow-up. Mr. Chairman, the nominee is before us and has in Bono told this honorable committee what he said. Mr. Chairman, I have what the honorable nominee said on tape. I have it on pen drive. And what the honorable nominee claimed he said, as repeated on this set, is not true. And Mr. Chairman, with your permission, I would like us to play back and compare what is on tape to what he claimed he said at the place. Because, Mr. Chairman, this is important because the honorable nominee is on record again to have said there was no generator at the University of Ghana Medical Center. It turned out not to be true. The honorable nominee is on record to have said he didn't have COVID at the time he had COVID. It turned out not to be true.
Honorable member.
Mr. Chairman.
You know, there are rules about anything you want to do in here. If you want to do a follow-up question, please do so. But for now, leave the commentary. Just go out with your question. You said you want something played. There's a rule for tendering what evidence you have. If you follow that, you'll go through it. But for now, you may please proceed with your question.
So, thank you for your guidance, Mr. Chairman. So, I wish to tender in the voice recording of the nominee for this committee to consider and compare with what he has told us that he said on that day. Mr. Chairman, with your permission, I tender in the voice clip.
You table it.
Well, I tender it in.
No.
I table it. Thank you.
Please take hold of it. Yes, please proceed.
All right. Mr. Chairman, this is now to my second question. In the absence of handing over notes, I went to look at the report of the Appointments Committee of the 7th Parliament when the nominee appeared before a similar committee. I went through some of the assurances that the nominee made to this committee. And Mr. Chairman, with your permission, I've just underlined about 4 of those assurances. And I would like the minister to speak to these assurances and explain to this committee and the people of Ghana how he kept those assurances, how he met those tasks that he set for himself. With your permission, Mr. Chairman.
Yes, go ahead. I thought you were going to ask him questions.
I just wanted to, for him, if with your permission, to look at those that I have marked and speak to them, Mr. Chairman.
Kindly ask him questions from the document.
The question is, I want him to tell us how he has met these assurances.
Kindly read out the assurances he gave. And
okay, thank you. So, on ongoing projects, he assured the committee that one of the first things he will do, if given the nod, will be to request for stock taking of all uncompleted projects and adopt the appropriate actions in respect of each of them. 2, on how he will make mental health services more accessible and efficient throughout the country, the nominee stated that since the Mental Health Act 2012, Act 846 is yet to be implemented, he will give serious attention to get the law and ensure it is fully implemented to improve mental health service delivery in the country. On improving access to healthcare, he proposed the creation of an exclusive list for the elderly to enable them access the healthcare services they require. He was optimistic, improving maternal healthcare. He was optimistic that we will be able to achieve our targets in maternal and infant health by the time the program that the ministry was running at the time is completed. He promised to bring a report to the House after his first year in office on the status of the program. These 4, Mr. Chairman, how he has performed on these 4.
Yes, Honorable Minister.
Thank you, Honorable Chair. I think I'll start with ongoing projects. Mr. Chair, I had a long list of projects that were ongoing when I inherited the ministry. Like you said, I took inventory of what was outstanding. And as I speak, the few ones that have not been completed, there is work ongoing on them. It included the phase 2 of the Tamale Teaching Hospital project. That has been completed and commissioned. Honorable Haruna will bear me out. Not only there, the long outstanding Eurojet projects that has 7 hospitals. We have commissioned about 4 of them, and there's work ongoing in about 2 or 3 that has not been done. We've done and completed WA. We've commissioned Pifupraso. We've commissioned Nsoko. Now they are working seriously in Sewua and Konongo. We have commissioned Tepa. The ship compounds or health centers that President Mills started, 10 of them in Central Region. I supervised and signed more than 30 certificates on each to complete the projects. And remember, it was published when I went to...
Did you do the stock taking?
Yes, why not? I did a stock taking. I don't think I have
you can move to the next one.
So I did a stock taking. I've completed virtually all of them. The ones that have not been completed, there is work ongoing on them. And I can mention specifically some of them that I can remember. Okay? Including even Bekwai. That was left there for years. Right? Yes.
No, please. When we say Bekwai, let's not bring comparisons.
Honorable colleague from Bodi, yours will soon come. Please, let me finish my question. We will give you a hospital. Don't worry. This one, I will assure you. So you can also write it down. No, it's only my colleague.
Yes,
Bodi.
Please proceed.
Bodi is a very deprived area. We will see to Bodi. Now, the mental health. We have revised the policy. We've got a law in place. We have done the LI. And through that, we've managed to get some funding from DFID. That is giving them close to about £400,000 every year to begin to do mental health issues in the country. I've worked on that. Now, exclusive list of the elderly to take care of them. Honorable Chairman, honorable colleague from Bodi, I shouldn't even have mentioned this. This is between the two of us. So I've withdrawn. Let us put on record. So, Honorable Chair, with your indulgence, let this be on record that the assurance to Honorable colleague from Bodi has been withdrawn.
Please, let's proceed.
So let me continue, Honorable Chair. We have started engaging in gerontology seriously in the ministry. We've just launched our HR policy, revised one, that is going to take specific care of the elderly. We are trying to fast track the training of some of our young people who are learning to become nurses, those especially with certificate grades, to do post-basic diplomas in palliative care and geriatric care. That is an area that will take care of the elderly very much. We have started piloting on my own resources.
Now. Just to save time, Mr. Chairman.
So it's okay, then I can move.
You haven't done the list now. You said you would do an exclusive list. That's what I asked for.
Now, maternal infant mortality, the indicators have actually improved. And I think I can lay the indicators in the chamber after we arise. Mr. Chair, I think I'm done with these questions.
Yes, you have your last one.
You're not done, but we'll move on. The Public Procurement Authority Board, on 13th March 2019, at its chief meeting, overturned, or if you like, annulled a contract that your ministry awarded to Pharmanova Exports Private Limited. In the board's minutes, the reasons given were: 1, the decision by the respondent, in this case your ministry, to award the contract to Pharmanova Export Private Limited of India is hereby overturned and the award given is duly annulled. 2, the respondent is hereby directed to disqualify the two companies, Pharmanova Export Private Limited of India and Pharmanova Limited of Ghana, on the basis of the tender documents and to conduct a re-evaluation of the remaining tenders received using a completely new panel of evaluators. 3, the respondent's attention is drawn to the matter of pricing and ensuring that value for money is attained. Consequently, the respondent is advised to be mindful of the pricing submitted by other tenderers and to desist from entertaining excessive prices as guided by Section 28 of the Public 28A 2D of the Public Procurement Act 2003, Act 663, as amended. Now, Mr. Chairman, I'd like to know from the nominee that what resulted in the PPA board having to step in to cancel this award, and if the nominee is minded to also speak to an assertion that he subsequently, through the ministry, awarded a sole sourcing contract to one of these companies that were denied, that was disallowed from carrying out the contract. Thank you.
Yes, Honourable Minister.
Thank you, Mr. Chair. Mr. Chair, this was brought to my attention from the PPA, and I think the report is read. Let's say about 90% was contained in that message I got from PPA. I quickly invited the Procurement Authority Chief Executive and requested that they should come to do a procurement
Chairman, sorry,
audit.
for the record, who was the Chief Executive at the time? Just a name for our record.
Mr. A.B. Ajay. I called him on phone that when I got the phone, I went to pick the documents, the tender and evaluation entity tender documents, and looked at it. And I asked him to send people to come and do a procurement audit to guide me solve the problem that has been created. Now, it took the PPA close to about 3 weeks before they brought the auditors to come to do the audit. When we got the report, I did exactly what recommendations they gave me, that we should do re-evaluation. I expanded the re-evaluation committee and brought in more pharmacists from across the country to come and sit with my procurement people to do the evaluation. It took us a little bit of time. When they finished the evaluation, I sought audience from FDA because the vaccines they were bringing, antisnake venom, is a very delicate issue. Then FDA also came to give me some advice on what steps we should take. Mr. Chair, before I was aware, the PPA had given Ghana Health Service sole sourcing authority to bring in the product we were seeking to procure to serve the system because we were running out of these antisnake venoms. Ghana Health Service didn't have any budget for it. It wasn't their procurement plan, but PPA allowed the procurement to go on within the Ghana Health Service enclave. FDA registered the products and tested and released them into the system. Then they came to payment. The budget that we have set aside to do the payment if we had procured through the window that we were procuring had to be used to pay for what Ghana Health Service had procured. So we ran out of budget to procure antisnake venoms by the ministry. I contended myself with what has come in the system said that we could run. Mr. Chair, when I went into the ministry, Antisnake venom was done on sole sourcing basis. 2017, they have virtually selected and completed. I only signed to bring in Antisnake venom because they were running out of stocks. I commissioned that we should go public tender and get the procurement done through the entity tender committee instead of sole sourcing. And then this problem was created virtually for me. We wrote back to Procurement Authority that we don't have any budget again to continue this particular procurement, so let us hold it. Then I asked my chief director for advice. And then he said to me that instead of going up and down and getting these challenges, why don't we add this one to the list of medicines we're going to do with framework contracting, so that when we select a supplier from that window, then the hospitals can procure from that supplier as part of the framework arrangement. Even that, Central Tender Review Committee said no, we wouldn't allow that. Then I began to sense that there was some politics around the procurement of the anti-snake venom. Somebody had petitioned. When you move here, there's a petition here. When you move there, meanwhile, we're running out of stocks. So I had to go to make a presentation to a Central Tender Review Board before they allowed us even to include it on the contract, framework contracting window to enable us procure vaccines to do the work. So, Mr. Chair, I believe I took good steps to get these vaccines into the system to avoid people dying unnecessarily. And I don't think I have had any serious infractions on this matter. It is not pending anywhere. There hasn't been any report. Central Tender Review Committee has given eventual approval, and we have gone ahead to do the procurement to enable that we stock the system with necessary vaccines to stop snake bite deaths. Thank you,
Chairman, I have a small follow-up to Honorable Sohine. Was there objection by the Central Tender Board in addition to the Public Procurement Authority on the procurement of this particular anti-snake venom that officially you were written to?
The objection was on our inclusion of the snake venom in the framework contracting list.
Did you have a problem with Ghana Health Service undertaking that procurement activity as an independent institution under your watch as minister?
Yes, I did. I raised issues with Procurement Authority as to why Ghana Health Service did not have it in the procurement plan, but they approved sole sourcing for Ghana Health Service to procure the medicines. But because we were running out of stocks, I allowed it to go. And my admonitions to the Director General was, why didn't you consult with the minister before you took that step?
Does something ring in your mind, some approval from the FDA of what medically is known as VINS? Does it ring a bell in your hand?
Yes.
Of its approval and accreditation?
Honorable Chair, when I went to the ministry, the product I signed for them to procure was the VINS product.
Are you aware that His Excellency President Nanado was petitioned on this matter?
The petition went to several places, even including Parliament, if I can remember.
I'm more interested in the one which went to the President. I will be happy what actions
on my copy, on my letter, I saw a copy to the Office of the President.
To the President. Chairman, probably when I get my opportunity, this may be some of the issues for which we'll demand further clarity on. I thank you, Chairman.
Yes, Honorable Reverend Asen South, yes.
Honorable Chair, I am grateful and congratulations to you, Honorable Minister-designate, on your nomination. Your tenure as Minister for Health within the period 2017 and January 2021 was characterized by a relative quiet on the labor front, which recorded very minimal labor agitations. That obviously is a notable achievement to your outfit and that of your team. However, given the current circumstance that we find ourselves in the midst of global health crisis, going forward, what policy and strategy do you intend to prefer in terms of compensation, incentives, and in terms of stakeholder engagement to be able to achieve a continuous courting of cooperation and support from our health workers and in particular our frontline workers? Thank you.
Thank you, Mr. Chair. Mr. Chair, I went into that ministry taking cognizance of my background, not being a medical person, with a lot of humility, a deep sense of humility, to respect people in that ministry. That is the only trick that has worked for me. I got tremendous support from the Minister for Labor and Employment, as well as the President and the Finance Ministry. We did negotiations. At times they were tense, but we managed to solve our problems indoors, never coming out. And some strategies I can't pour out here, but one thing I want to remind the committee, Honorable Chair, the fact that I was trained in management accounting, a workroom manager who should be able to work in every sector of any economy. And that is the knowledge base that I have that has helped me do what I've done that you are commenting upon. Going forward, I will continue to use that same strategy and enhanced things. I do a lot of stakeholder engagement. I meet with them quite often. We chat together, and I get their problems to be resolved. Assurances that you're asking me to give will be very difficult for me, Honorable Chair, because all that you do will have to be done with the approval of Minister of Finance, and they will have to consider their, how do I call, indicators and their budget caps and things like that. So it will be difficult for me. But I believe I'll continue to fight for what will be good to satisfy the health workers that I work with, such that we continue to have a very congenial labor atmosphere within the sector. Thank you.
Mr. Chair, there is an age-old challenge confronting the health sector of the country, specifically to do with doctor-patient ratio. Over the years, we haven't been successful at attaining the World Health Organization WHO recommendation of 1 doctor, 1:1,320. At the moment, we are at an alarming ratio of 1 to 10,450. What policy framework, as Minister for Health, should you be approved by this committee and subsequently by plenary, would you implement in the medium term and in the long term to be able to achieve optimum levels of doctor-patient ratio in Ghana?
Thank you, Honorable Chair. The only strategy is accelerated training and facilitation of young doctors, medical officers, to go for training. In the meantime, over the last 4 years or so, we have introduced free postgraduate training for all medical officers in our country. So those who get admission to go to the college, the government pays for their fees. And that is enhancing them to come to specialize before they qualify to go to the fields to work. Again, when I talk about selected training, schools are getting expansions to intake more students to do medicine. There's a policy that allows accreditation for private sector facilities to also train doctors using public clinics in partnership to train them. Again, government hasn't stopped sending young graduates outside to also train to come back as doctors to help our system. So these are strategies that we are using to try to see if we can, within a very short, medium term, cut down this type of racial inequity, imbalance to help our system. Thank you, Mr. Chair.
No, Honourable Member for Medina, is that right?
Thank you very much, Mr. Chair. I want to use the opportunity to congratulate the nominee for his re-nomination for the position. And talking about the labor front and then manpower, My colleague just made reference to doctor-patient ratio. I am aware that as we speak now, we still have about some 580 qualified medical doctors, new medical doctors, who are yet to be posted or absorbed into the system. What would you do in the shortest possible time if you have the note to ensure that these doctors are absorbed into the system?
Thank you very much. I'm a bit surprised at the numbers my colleague is giving me now, and I'll quickly check on this if it is correct. Because for the last 2 years, we have changed our system to avoid young doctors staying home for any period of time before they get posted. Fortunately, we are getting financial clearance from Minister of Finance to the extent that even if it's a single doctor who has qualified and hasn't got a place, we'll write to them and they'll quickly give us financial clearance to actually employ them. So I'll quickly check on this, whether we have got their financial clearance, whether their financial clearance is still in finance, and what is actually holding on their postings, and for how long they have stayed at home. When I do that, probably these things will be resolved as quickly as possible.
Mr. Chairman, the second question again is on labor-related matters. One of the institutions that has widely abused the use of contract workers and has been the Ghana Health Service. There are several numbers of workers across the country who are taken as contract workers, and contrary to Section 75 of the Labour Act, have these contracts renewed over the years, and some have served as much as 17 years, 16 years, and yet they still are casuals within that space. What would you do to mechanize these casual workers when given the nod?
Thank you, Honorable Chair. Honorable Chair, as early as 2017, when I was sworn in as the Minister for Health, I started that area and I wrote to all health facilities not to recruit contract workers, for us to engage to find out what. Like I said earlier, I went to the sense of humility and positioned myself to learn. So I was learning from the system at the time, even before I wrote that letter, because I realized that it was infringing on some aspects of our labor laws. The one I stayed on and they were tutoring me and I was learning very fast and I got the experience in it, I seemed to have agreed somewhat with what they had. They were not getting financial clearance in the past, prior to 2017, and they needed people to work, especially orderlies, people who are cleaning the hospitals, people who are washing, working the laundries, including even nurses and midwives. So we have to accelerate recruitment and see how best we can mechanize these people. They have been allowed by the guidelines of our internally generated funds in the facilities to pay such staff with what they generate internally. And I was a bit amazed. The IGF, they have approval from finance to utilize to do recruitment at the facility level. But that was also helping the system. So I couldn't sit there as a minister who understands and knows the laws and stop all these to break down a system. So I started engaging. And that is part of why we have been able to recruit close to about 90,000 people, in addition to those that we have mechanized. Over 90,000 people, yes, in the last 4 years. And we are still engaging with finance. We write, we do budgets, we put in the non-mechanized staff to try to mechanize them. I've had engagement with Ghana Health Service. Our strategy initially, I was suggesting that why don't they even surrender the IGF and let us put it in the consolidated account so that we can mechanize them and get paid from there. We are still working on some of these mechanisms. We haven't come to a conclusion yet. But I believe over the next 3 or 4 years, if I get a note, some of these problems will be tackled a little bit more vigorously.
I follow up. Very well.
Honorable Minister, I want us to be clear. Are we talking about casual workers or contract staff?
They are casual workers.
Casual. The question started from contract workers. That's what I want us to be sure.
No, these are terminologies that are used interchangeably within the facilities. I want to believe that not 90,000 casuals, please. I said people. Nurses and midwives and new administrators and new accountants and some mechanized, non-mechanized have been put there. That is
very well. Yes, you may continue.
Thank you, Mr. Chairman. Just a quick follow-up. Honorable Minister, would you be able to give this committee and the people of Ghana and all these people out there some time frame within which we can work this thing out? Because some of them have been basically exploited for several years.
I would say I have taken cognizance of this problem. But for me to sit here to give time frames, I don't control the issuance of financial clearance. So my ability to resolve the problem will depend on what time frames Minister of Finance will give us the room to be able to do the mechanization. So we are still working on that. It's work in progress. And for me to give time frames will be a little bit difficult for me.
Very well. Mr. Chairman, my third question is on mental health. When you look at Section 88 of the Mental Health Act, it provides that mental health care is free. Now, this act was passed as far back as 2012. But we know there are serious challenges with funding with mental health in the country. Would you consider a potential amendment of the Act to place mental health care under the National Health Insurance Scheme? Because as we speak now, when you come to Pantine Hospital, a lot of people with mental health cases come, and some don't even have money to pay for folder and very basic services that under the Act are required to be free, but unfortunately are burdened with payment for these services.
I think I'll answer very simply, yes. It is under consideration. We are talking about it, but simply I will say yes, I will consider. If the amendment of the law is what will solve the problem, I will so do. Instead of administrative instructions, I continuously gave. So I'll consider that.
And just a quick follow-up, because I mentioned the Pantine Hospital, I don't know whether it has come to your notice that the mental health facility at Pantine has been heavily encroached. The space, the government lands around the hospital have been heavily encroached. If it has come to your attention, what is the ministry going to do about that? Because my understanding is that the staff and health have actually submitted several petitions to your office as a minister.
Good. Honorable colleague, I'm very much aware of the encroachment in Pantine. We started even doing some fence walls in some very critical areas when we started rehabilitating the Ghana Health Service Training Facility and turning it into a treatment center, which is now being completed. We have already a contract for some fencing to be done, but not the entire stretch. At one stage, I asked one of my deputy ministers to go and contact the chief executive of the La Quantanai, this assembly, to stop issuing permits to those who are building in that area. My investigations indicated that the frontage of the facility was like somebody's land. Then I said it can never be true. Kwame Nkrumah will not establish this place, the former president, and leave the road in front of the hospital as somebody's land. So let us go to Road's Ministry and find out the original site plan of Pantine Hospital to see if this part is not a road. Then the courts will grant, how do I call it, judgment to people and give them title to the land. So what we plan doing now is to try to do compulsory purchase. And we're engaging with finance to give us money. We send land valuation to do some cost estimation for us to try to see if we can find resources to do compulsory pitches and even pull down. The irony was that one of the buildings is so close to a mortuary in Pantan. Meanwhile, the person has built there. And every time you go there, they bring their people. At one stage, we were thinking that we send in the police and the military. But I said to them, don't let us do that. We don't have the law backing us to do that sort of thing. So let us respect the judgment that we have. So that has become a serious albatross on me. And I plan setting up a small committee in the ministry to look at not only Pantan, Tema, Cape Coast Teaching Hospital, the mental hospital even in Cape Coast. Their lands have been encroached. And we have to find something to protect these lands. I believe that to not be just the problem of only the health minister, but all of us, members of parliament and the Ghanaian citizenry alike, to protect what lands we have. The irony, again, is the fact that now there are some facilities even where you want to expand. There is no land for us to expand. We are looking for land to build a facility in Swami. We can't easily get. The facility at Kansawo, no doubt, never saw completion because of land. Medina, the Ghana East Hospital should have been in Medina. We couldn't get land. So the lands that we have, abandoned our facilities, should be seriously protected. And I think it's on my agenda to try to see what little efforts I can put in. But I will need your support, colleagues, and other well-meaning Ghanaians in the country to help us fight this encroachment battle. Thank you, Honorable Chair.
I sympathize with you. It's largely, the problem is with the management of the facilities. People are taking it, they see it, they will not protect it. Sometimes they even colonize with them. Then you are sitting at the ministry, they'll bring the problem to you. Yes, Honorable Member for Abetifi, is that? Yeah, Abetifi, yes.
Thank you, Honorable Chair, for the opportunity, and congratulations to Honorable Agyeman-Manu. Honorable Minister, on COVID, the numbers that are coming out, I'm sure as a management accountant, a chartered accountant, you see them every day. Do you have true faith and believe in the numbers that are coming out as COVID numbers for Ghana? Currently, 73,000 and 482 dead. Do you have true faith and believe in the numbers that are coming out? I do, but I want you to assure Ghanaians that the numbers that are coming out are accurate.
But I would say, if I don't, who else will? This is coming from our outfit, an agency that is dedicated to do this work. Then I sit on top of them as a minister and come and sit here, I don't believe in the numbers. Please, I do, and I do, and I do.
Thank you. The global mortality rate is about 2%. 106 million infected, 2.3 million dead. In Ghana, 73,000 with 482 dead, unfortunately. The global average is about, unfortunately, I cannot say fortunately to, for.
Temptation, sorry, Chairman, with the indulgence. The temptation for him to have said, fortunately, is the fact that he's comparing with global numbers. That is why. But not that he hasn't got sympathy for the dead. And honestly, if you watch CNN and BBC, you will be tempted to use the word fortunately.
Right, thank you. 2% is what the global numbers stand at. Ghana is 0.66%. We are not asking for more. What are you going to do when given the nod to further bring these numbers down, even though we are doing much better than the global average? What are you going to do to bring these numbers further down to save lives of our citizens?
Thank you very much. Honorable Chair, we have battled COVID for the past 10 or nearly 11 months. The strategies we have used, I would say, has worked somewhat for us in Ghana. if you look at our deaths, if you even look at infection rates, at a point where we slowed down transmission to this level, we must be thankful and grateful to God and our president for leading the battle. If you look at the globe, the same protocols and the same things that we are doing here are about the same things everybody is doing. Fortunately for us, we even seem to have no more than some even in America. Because when COVID started, what we started doing in Ghana, contact tracing to break the spread, some big people in America didn't even understand that. So we had moved. We are not going to change so much.
Chairman, so did you say these people or some people in America?
I said some people.
Okay, thank you.
Thank you. The Honorable Vice Chair has confused me a little bit with this intervention, right? The only new things that we are going to do are the new things that are coming up on the globe, the vaccinations. Apart from that, we are not beefing up our risk communication again. We've started even to try to make sure that Kenyans are there to the protocols. That is the only solution. But Kenyans, we are in the habit of blaming leadership and maybe the minister and the president for not doing enough. We forget the fact that I ask you not to drink this one, and you are drinking. They'll come and tell me that you caused me to drink or what. So enforcement of the rules can be there, but voluntary compliance is what is lacking that has taken us to this level. The latest upsurge that we got, you realize when you begin to do contact tracing, a family went indoors somewhere to celebrate 50 years anniversary. The mom is dead, the father is on sick bed, the daughter, elderly grown person, is severely ill. So it's like all those in that family, just because of a, how do I call it, a birthday party indoors. We keep on telling people that wear face masks. You don't stay indoors continuously for 2 hours, because even there, the face masks don't become very effective. You see, all these things we are ignoring. People stopped wearing masks in taxis and trotros even when we ease up. And what we know is that when you are open air in the sun, transmissibility is not too huge, like sitting indoors and eating and drinking. So these are the challenges that we have, and I believe now our communication should be encouraging people to adhere to the protocols as strictly as we can, and then keep distances and see how we can avoid it. The government is trying to bring in vaccines for us to vaccinate, but even that, after vaccination, first dose, you need about 28 days to do the second dose. Even after that, the nature of this disease is still not very known even to great scientists on the globe. We will still have to keep on wearing our masks. Even if vaccines
Brian, I hope I have your excuse. The minister just said government is trying to bring in vaccines. When is the first vaccine in Ghana? We live on hope. And when can Ghanaians expect that they will have a shot of the vaccine? Thank you, Minister.
Honorable Chair, this is Parliament and House of Records, and I will be very circumspect. The indication that we have, those of us working in trying to bring in the vaccines, is between mid-February and early March. As for specific date that we are getting any vaccine, we still do not have any indication. The stocks on the globe.
Chairman, but there are dates in the first week of March. We need firm assurance for the Ghanaian people. Vaccine, when do we expect it in Ghana? Mid-February. Give us a limited date.
Honorable Leader, I think we should leave it as this. It's a very short period. It's just between mid-February and early March. Yes, but it's not mid. So we should allow that space. He has already said that.
Okay. Okay, thank you.
Despite the president's efforts, talking to top people in Gavi, UNICEF, government bilateral levels, diplomatic high levels, there is not a single indication of a date. All they are saying is this period. So we are waiting for the period to come. All the necessary registration and orders and all that, we have done our quantification, we have developed our strategy to complete finally. But even because of the date, as to the exact particular day that we will start our mobilization, all we are doing is preparedness. Say that if you come tomorrow morning, we can get there.
So is there a procurement plan, and are you part of the procurement process?
I'm leading the procurement of the vaccine.
Thank you. Honorable nominee, you advise that the way to bring the numbers down is to adhere to the protocols. Meanwhile, in Ghana, the UN 2020 reports that 6 million of us are poor. Adhering to the protocols requires wearing of masks, use of sanitizers. It costs money. Are you going to, when you get the nod, provide the poor with sanitizers, nose masks? They just can't afford it. Thank you.
I will say yes or no. When we identify the very poor who cannot afford, we will try and give them these masks. Honorable Champon, be very honest to the committee. You, during the campaign, where we were going around, were you not distributing masks to the poor? All of us, everybody tries to stretch our hand to go. The government, no, this was not a question, it's just a commentary. It's just a commentary.
It's all right.
Things that we are doing already as MPs, they come to your house, you give them masks.
Honorable,
the government is pumping,
Honorable nominee, thank you very much. I recall saying this when we made a statement on the floor of the House, that we should congratulate ourselves for the support we have given the country in these matters. So we should continue. Yes, are you done?
Yeah, no, Mr. Nominee, final question. How many, we started your vetting at 10:30. I think it's almost 1, and we are still here. COVID times, how many hours will you advise that we stay here?
Honorable Chair, I was going to crave your indulgence to tell you what the scientists are saying across the globe. That we shouldn't stay indoors. We should try to avoid maximum 2 hours. That is it. But because I was threatened a little bit with the fear factor, I couldn't admonish. So that is the rule. And if you take my advice, Honorable Chair, I think you have interrogated quite a lot, and we can close.
You remind me of saying the same thing 4 years ago, when after 2 hours you said, "Aren't we tired?" We are not tired. Members of your leaders say you want to hear the lady's voice before they come back to you. So, Honorable Mrs. Ejare.
Thank you very much, Mr. Speaker. Congratulations for your re-nomination to the Ministry of Health. Still accounting for your stewardship at the Ministry of Health, I refer you to page 34, paragraph G of the MPP manifesto of 2016, where it was stated that all existing hospitals will be revamped and then new ones will be constructed where there are none. In Techman North, where I come from, there is no district hospital. And from 2017 to 2021 January, when you were Minister for Health, there was no sign of you in respect of a district hospital. And I also want to know what happened to the rest of the about 260 districts. Thank you very much.
Honorable Chair, I was trying to refer to Bono East. Tubodom has been captured here. Luckily, I've got it easily as part of the 101 district facilities that is coming. So Tubodom will get a hospital. Your own, I will not withdraw that one. because I have seen it here. Okay. Now, let me admonish. My passion for health is quite high. Left to me, every little corner of this country should have access. Why? Because I'm part of those who are championing universal health coverage. Our president, together with 2 other presidents, actually calls the action plan to achieve that to be done. We have finished our roadmap, and I'm very thick in affairs with my directors who are working on this. But you see, when you are sitting in a system like ours, without so much resources, and the finance minister will have to distribute resources to education and to roads and to everywhere, what is given to health cannot do the type of things we said we will do all of a sudden at a go. So it's a gradual process. Over the last 4 years, I believe you will appreciate the type of investments that went into health. Apart from COVID, even health infrastructure, how we managed to complete the projects that were started by our predecessors, the type of new things that we plan doing. And I believe going forward gradually, this type of pledge will be fully met. Thank you.
Okay. Mr. Speaker, as a follow-up to this one, how sure are we that these same reasons will not be given for your inability to do the same in these 4 years when you are given the nod?
This assurance will be very difficult for me to come up with. If you are lucky to drill more wells and prices of oil goes up that high and the allocation to health investments becomes big, maybe yes, but for now, it will be very, very difficult for me to tread into the unknown. Thank you, Mr. Chair.
Thank you very much. My next question is on the La Osu Teshi Nungwa Hospital. My information is that it's been pulled down, and it was pulled down last year, and one was supposed to be constructed in earnest. There is an amount of money, about 68 million euro involved. Can you also update Ghanaians on the status of that?
I haven't been to the site for the last 2 or 3 months, but what I know and report to my desk is the fact that that project is ongoing. We passed through Parliament and money has been secured. If there are problems, there may be administrative hiccups, but I will follow up to see when I get a note how quickly that will spring up. But I know they started work there before even Christmas. Thank you.
Yes.
Yes. As the chief advisor to the president in matters of health, what is your advice to him in respect of the schools that has reopened, COVID, and lack of PPEs?
To the best of my knowledge, we have supplied PPEs to all education districts in this country. We awarded contracts a bit late, but as I speak, the report I have is that over 85% of supplies have moved. Liquid soaps, sanitizers, the face masks that we saw in country have all gone. What delayed some of them were the kindergarten type face masks for the very, very toddlers and kids that were in zone very quickly. But they have started shipping all that. The military is supporting us with distribution of the logistics, but things are moving gradually to all the districts in this country. They give us a distribution list that we are submitting, sending all these things to.
Thank you very much.
I have one more.
Oh, I thought you have had 3 questions.
No, 2.
Yes, go ahead.
So I'll do a last one. And this last one will be in respect of rapid test kits for testing coronavirus. I'm also told that the application of the FDA for approval for some of the rapid test kits to be used on the market. Are you aware of that? And then what steps are you taking to ensure that they go through the protocols as quickly as possible so that we could have as many rapid test kits on the market as possible to help reduce this menace called COVID?
Earlier on, the scientists didn't want us to use these rapid test kits at all for COVID testing. So we're all relying on PCR testing all the time. In view of that, FDA set very stringent and very high standards to pass through because they thought that the rapid test kits were not very, very efficient in detecting the positivity of the virus in any human being. Now, FDA has registered 2 of these products, and they are still taking, how do I call it, samples to continue testing. The 2 will soon be mobilized. They are now developing guidelines for it, and I believe by close of next week, Professor Ampofu's outfit, who is heading the laboratory testing group, will come out to the guidelines for us to utilize. So 2 have been approved, and I believe soon it will come on board in the country.
Thank you.
Yes, no, from majority I have to go to minority, I'll go to majority. Yes, Hassan.
Thank you very much, Mr. Chairman. I want to congratulate the Honorable Minister for Health Designate on your nomination. Honorable Minister-designate, you agree with me that every now and again, health professionals posted to the rural areas would normally request for transfer to areas where there are better amenities and facilities. I believe that there's a way that we can retain them in the rural areas. Do you have any plans for us to be able to retain the health professionals in Gushegu, the rural part of Gushegu, for instance, so that they don't even have to come and then work in Gushegu, but they can go to Nahuhogu or Nabule or any other place, for instance?
In Gushegu Township, we sent some nurses there who had come back, they wouldn't stay in Gushegu. It's a problem. An old age one, I think we've mentioned it even here this morning. It is always on our plan. We are trying to package incentives to actually push people in there. But again, like I said earlier on, we can also assist. One of our colleagues has actually taken on board 2 doctors, a young man and a wife. He has facilitated them to get a vehicle such that they will stay in his constituency to work. These are little support probably we can also give to help us move doctors into our areas. So we are working on that, and we are a comprehensive package with cabinet approval, supported with funding, and I believe that can do the trick for us. They started it some time back by collapse because the identification of deprived communities. All of a sudden, everywhere is a deprived place, and the whole thing collapsed, just like the additional duty hours allowance that was abused and collapsed. So we're working on it, and this time we want a very robust package that will live the test of time. Thank you.
Thank you very much, Mr. Chairman. What, in your estimation, can you say are your 3 topmost success story as a Minister for Health in the last 4 years?
Honorable Chair, this is self-assessment, and I wouldn't go far. I normally don't keep my achievements in there because it would be like you are going to go and you're boasting of what you have achieved. You know, but so colleagues, you can help me. You have mentioned the serene labor environment within the health sector. I think that is a huge achievement. COVID management is another huge achievement. The drone technology, the introduction of specialist training allowances, that is for free now. The health training allowances for free, not only Sankore, everywhere, you know, including Tamale and everywhere. So there are a lot of them.
Bekwai Hospital,
I think
number 1.
The construction of Bekwai Hospital. Thank you, Mr. Chair. Not only there, even the awarding of the 44-year-old Konfanochi maternity block. You know, 44 years. And the completion of the, what is Honorable Atufosin is not here, his hospital. I completed it. And when we went there, his young men pelted stones at the health minister. They said, what is this crime? Your hospital has been started. I've come to complete it. We are coming to commission. You are driving me away. But my friend patted my shoulder and said, Kwaku, don't worry. You know, the one in President Mills's place, Ekumfi, 5 in, Greater Accra, several of these. So I wouldn't say I have failed, but I don't want to boast. I have achieved a lot in the health sector. Thank you. Where?
Please ignore him.
For not giving
Honorable, please ignore him. Yes, your last question.
Mr. Chairman, I think that this will be my last question. You alluded to the fact that at some point in time you tested positive, and then you took it, in your good stead, announced to the Ghanaian people, and went through the treatment regime. Now we are being told in recent times by the experts that males suffer from some amount of, erectile dysfunction. Can you confirm whether that is the case? As a minister for health, you have a responsibility to educate the answer.
I said don't answer that one.
Luckily for me, my wife is here.
Mr. Chairman, Mr. Chairman, this is a matter that I believe Honorable Napo and Honorable Esla have been arguing very strongly about. And I think he can settle that for us.
You are out of order. Very well. But, I'm sure the public want to know the science behind those things. Sometimes some of the things on social media are not generally.
As a doctor, one thing that we've observed is that COVID attacks all parts of the body, from the brain to the toe. So any part that is necessarily weak in that person will get worse. Who else? So that is the ball point. So some people, they are COVID when they started having it. I started not with body aches or something. I started with stomach runs because I have a very temperamental stomach. So it depends. Some start with a lung problem, some start with headaches, some start with bad body aches and things like that. But it attacks, because it attacks the blood vessels and the blood cells. So everywhere where you are weak, to make it worse.
Thank you very much. Thank you. Eric.
Thank you very much, Mr. Chairman. Honorable nominee, I would like to take you back to an issue I think you did not adequately address. Can you share with the committee the processes that led to the selection of the unlicensed company to do the COVID testing at the airport, and whose mistake occasioned that unfortunate situation?
Mr. Chair, I thought I've answered adequately this question.
Yes.
Honorable Eric, he answered that he was not responsible. The Presidential Task Force, and we'll make some requests in that respect. So if you have another question, kindly.
Thank you very much. The second question has to do with the fact that there is a strong relationship between health infrastructure and healthcare delivery. And looking at the huge infrastructural deficit that confronts us as a nation, one would expect that we will marshal all resources in an attempt to close the gap. Honorable Minister, you have been in charge of the sector for the last 4 years. Can you indicate to the committee where in this country that your ministry started and completed the construction of one district hospital? One district hospital started and completed in the last 4 years.
Honorable Chair, the outbreak project is not fully completed yet, but it's close to about 90% complete. Now, I had challenges in the ministry initially. If you look at projects that have been started and left before I joined that ministry, it was very difficult for me to go fight for new money for new facilities when some had been abandoned and some had not been completed. So my strategy, as I showed the previous appointments committee when I came for vetting, was to try to complete the ones that have not been completed. So the first 2 or 3 years, my focus was in that area. And I must tell you, I'm very happy with my performance with abandoned projects and projects that had not been completed as I speak now. What we started came last year or so, 1.5 years. That is when, getting close to elections, you saw me commissioning and doing sword cutting and several things in health. So going forward now, you will see a few ones that will come up, like the Lawan, the central medical stores, the
hold it. The Lawan, what's wrong with it? It's become a football park. So what assurance are you giving the people of Line in this committee, like General Hospital?
The contractor mobilized to site.
You see only the present commissioning plaque. Just there.
Honorable Chair, what I'm saying that since after Christmas, I haven't been to the site. They haven't done the site meeting to have brought me a report.
When you are confirmed, will you visit like General Hospital to monitor the progress of work since the president cut short for it?
Did you say I should go and do that? When I finish, that's okay. Thank you very much. But honorable colleague, you know how I told the country to see health infrastructure. Me, I won't leave this fence sitting down without me going there. You know my work. I was in Tamale on several occasions before
Eric,
I completed.
Continue, Honorable Eric.
Thank you.
Honorable nominee, do you mean that in the last 4 years, you did not build one district hospital? Is that the meaning?
We did several CHIP compounds and health centers.
I think I was specific. I said district hospitals. Why are you talking about CHIP compounds? No, I asked, Mr. Chairman, I asked a specific question.
And I'm telling you what we did.
You're talking about CHIP compounds.
And I'm telling you what we did.
Oh, okay. Then my next question has to do with the number of people you claimed you have recruited over the last 4 years. You just mentioned that you recruited 90,000 people in the last 4 years. Over 90,000. Okay. But Honorable, you are aware that when you recruit them, they must be paid. And therefore, the Finance Ministry, through the budget, will make provisions for the numbers and associated emoluments. When you look at the figures in the budget, it does not support the position you are articulating here. Because in 2017, the staff strength of the entire ministry, as contained in page 117 of the 2017 budget, was 103,699. In 2020, the number went to 128,016. So where did you get the 90,000 figure from? And who is paying them? The 2020 budget is for the whole 2020. You are talking about establishment, ceilings.
Honorable member, ask the question. Ignore their sides, please. Yes, Honorable Minister.
See, I didn't get the question very clearly.
Honorable nominee, I'm saying that you just indicated to the committee that in the last 4 years, your ministry recruited 90,000 health workers. And I'm saying that when you recruit, the Ministry of Finance, through the budget, make provision to be able to pay them. So the numbers and the associated emoluments are available in the budget. And when you look at the figures, the number of people recruited is not even up to 30,000. So where did you, yes, the figures are here.
Honorable Chair, I will crave your indulgence.
So where did you get the 90,000 from?
I will crave your indulgence, Honorable Chair, to later lay before you a template and the financial clearance that finance has issued to support my claim. Thank you, Honorable Chair.
Yes, go on.
Mr. Chairman, can you give him some specific dates? Because this is a statement of fact. And I remember in response to one of the questions, he said, this is a house of record. And he doesn't want to, he wants to be circumspect.
Honorable Chair, as soon as tomorrow morning.
That I'm asking that question.
Honorable Chair, as soon as tomorrow morning.
Mr. Chairman, My last question has to do with the COVID fight. You have been at the forefront of the battle, and you should be able to tell this committee how much this country has expended on the fight against COVID so far.
Honorable Chair, again, this is a very difficult question for me. How much this country has spent will be very difficult for me to do. We did intersectoral sort of expenditures, including even the military and the police and finance and education.
Chairman, Minister, they don't provide. Our difficulty is that the handing over notes that has been given to Parliament through the clerk, we don't have the specific on MOH, Ministry of Health, as in the ministry. So help us, how much have you spent, ministry as ministry?
I would say, you remember, initially we got $100 million allocation to spend on COVID. All that had been exhausted. We have got another money that is just about to mature for us to utilize.
Chairman, how much?
That is about $120 million from the World Bank.
World Bank?
Yes.
Is it a loan or a grant?
It's a loan. But some of these funds, I believe the finance minister had actually presented before the House some summary of these COVID expenditures before now. And I was thinking that these things can be very much elucidated by the finance ministry instead of trying to take this away from the now learning medical officer who has individually.
Don't you aspire in your heart to be finance minister?
Thank you. Pardon me?
In your heart, don't you aspire to be finance minister?
Is out of order.
Why, will you want to endow me as such? That you wait until probably the day you become president.
Honorable Minister, can you answer the questions and ignore their sides? Very well. Eric, you are done, right?
Mr. Chairman,
that was your last question, because I left the table.
I just want to seek clarity. Mr. Speaker, it's very important. Mr. Chairman, it's very, very important.
Yes, seek clarity.
I asked a question about recruitment, and I supported the issue with figures from the budget, which is in the bosom of Parliament. Now, the honourable member is talking about templates. What has template got to do with the budget figures I'm providing?
However, when he brings you what he has, then you compare. Well, right. Honourable member, can I move on? Yes. No more questions from here. Very well. Nee.
Thank you very much, Mr. Chairman. I want to first start with the issue of the medical laboratory policy, which has been on the shelf for some time now. Considering the pivotal role medical laboratory technicians play in the health industry, particularly in this time of COVID, what assurances are we having, and how are you going to, what roadmap will you be giving us to ensure that that policy becomes a reality?
Honorable Chair, if my memory serves me right, and I'll stress, I'm not very, very sure, if my memory serves me right, we seem to have completed with that policy, yet to be launched. But I have to check on it to validate my own assertion. We have worked on it, but I believe we have completed and even got cabinet approval for it to be launched. So it's left with implementation. But I have to check on that assertion. I'm not very, very, very sure. But my memory serves me right, we have done it. If we haven't done it on my checks, Honorable, I'll give an assurance that we will soon complete with it.
Okay. Mr. Chairman, my second question. the importance of medical laboratory professionals has not been given any sort of, let me say, attention as compared to the other professionals. This derives from the fact that scholarship packages and things which are given to the other health professionals excludes medical laboratory scientists. What are we going to do to make sure that they are brought at par with other professionals within the health industry?
Honorable Chair, we've revised the organogram of the ministry, and we have created a division for medical laboratory scientists, and we've brought a director to sit in that area to ensure that medical laboratory scientists are not left behind in the work we do in the ministry. Thank you.
In an answer to a question on the disparity in the distribution of health professionals across the country, you didn't really seem to tell us how this can be controlled. Let me ask you, region by region, tell me, how many doctors are in Greater Accra? How many are in Ashanti? How many are in Upper West? The same with midwives, registered nurses, laboratory professionals, please.
Chair,
yes, please.
This is a very, very difficult question. All I can say is that close about 82% of our doctors, are in Greater Accra and Ashanti region. This is all I can say for now. But if you want a very elaborate
two
one,
regions,
yes,
control or host
82%
of all the doctors Ghana has trained.
Yes. So if my colleague wants a very detailed analysis the way he's talking, I will crave your indulgence to request him to vote for me to when they get to a note, and then I'll submit to Parliament for his, to satisfy his curiosity. Thank you.
Mr. Chairman, it is important, and I will want us to take note of this because we've been talking about this for long. But clearly, the data has not been presented for Ghanaians to really appreciate the problems some parts of the country, like Upper West and rest, are facing in terms of health professionals. And so I will want to hold the nominee to his word for him to provide us so that Parliament as an institution can take a decision on how we can
No
arrest
problem, Honorable Member. He says if is approved, we'll ask that same question, and then he'll provide the data in Parliament, so we can all, because actually these numbers are extremely unfair. It's extremely unfair, so but we should get the details and discuss them.
In an answer to a previous question, the honourable member told us that 111 proposed hospitals, district hospitals, at a cost of possibly 7 million. That will be taking us to close to almost 777 times the exchange rate today. We are talking almost about 45 trillion OCDs. That is 4.5 billion Ghana cedis. Cedis. That's what I want to mean. 4.5 billion cedis today. Million. I want to ask you, let's be realistic. You have just said that there is always a priority areas like roads, social infrastructure and the rest, which compete with the demand of the Ministry of Health. Realistically, do you think we'll be able to get this money in order to make this promise of His Excellency the President become a reality within 4 years?
My simple answer is yes.
Very well. Yes, Agaga.
Congratulations, honorable nominee. I'd like to find out from you what informed government's decision to deploy critical care nurses to countries such as Barbados, Trinidad and Tobago in the midst of the COVID pandemic without taking steps to replace them at the various locations they hitherto were working.
Honorable Chair, there are one or two, let's say, a number of factors. What informed, I would say, part of bilateral relations for diplomacy. Just like we receive Chinese and other foreigners to come and support our health systems, I believe our president stretched his hand to also help other neighbors who needed some support. That is a significant thing. We took inventory of the type of nurses they needed, and we said to ourselves, we can let go some quantities that will not harm the system that we have. Again, the ministry itself, in our new HR policy, we are thinking of retraining some of our young people to even export them to help run the facilities and the type of human resources that we have. Mr. Chair, we have close to about 90 health training institutions that turn out close to 22,000 young people as nurses, certificates, and diploma students. We have to employ them into our system. If we continue that way for the next 5 years, our hospitals may be full with nurses that we don't need. As I sit here, when we're talking about doctor-patient ratio, we didn't talk about nurse-patient ratio. We have exceeded the WHO limits. Then I ask myself, can Finance Ministry continue to provide financial clearance? Can the budget soak it for the numbers that we train? So if you are talking about Ghana Beyond Aid, why don't we retrain to meet the demands of those outside so that we can probably support some of them to go and work outside and bring home foreign currency, just like the Filipinos do. It's a medium-term. This is one of the things that we are trying to test to see how viable that can be, which is the reason why we tried to stretch our hands to Barbados. And there are demands. Immediately we finished Barbados, Spain, Jamaica, Germany, Netherlands, UK. All of them are even coming. But we've held back because of the fear that we may deplete our resources unnecessarily until we train and retrain and we get larger numbers. That will make us export without causing any serious harm to our health system. Thank you, Honorable Chair.
Chairman, with your indulgence, are there shortages of nurses in some health institutions in Ghana?
I would say yes.
Why are you exporting what you lack?
Honorable Chair, I didn't pick him properly.
It says if you admit that there are shortage of nurses in some health facilities, why are you exporting some? Maybe he didn't listen to your explanation.
Because there are surpluses in some as well. So when these go and we try to readjust and realign, we'll still have the numbers.
And I say, with the economics in you, do you export what you lack?
Honestly, like I told, we don't lack nurses. What we lack is equitable distribution of what we have in the system.
So do you export what you are suffering iniquities with its distribution in Ghana? You have like how many?
Honorable Chair, it also has its own advantages as well.
Do that. There are no nurses. And yet government says that I'm not able to recruit them because of the very reasons you gave earlier, lack of financial clearance. So I just want you to reconcile eminent shortages in Ghana against gains of exports.
Honorable Chair, this is serious economic benefit analysis in economics. But we have seen times in our country where we didn't have nurses in hospitals, but about 3 cohorts were sitting home without jobs. So how do you explain that too? So we need to do a little bit of adventure. I mean, we can't continue to do the same thing over and over and over again. So as we try to explore what further advantages we can take, opportunities we can take advantage of, we try to realign here to see that we don't create unnecessary challenges to allow our young people to continue to sit at home with our jobs. That is what I'm trying to explain. And I believe this is good, how do I call it, policy that we may pursue, but with a lot of caution. And I keep on stressing that we do such that will not harm our system at all.
Honorable nominee, it has come to my attention that the main oxygen plant at Kolebu has been dysfunctional for quite some time, even in the face of the COVID pandemic, which relies heavily in terms of its treatment on the use of oxygen. Now, the breakdown of that equipment has undoubtedly resulted in the shortage of oxygen in some treatment centers. Additionally, the sterilization plant at Kolebu Teaching Hospital has also been down for quite some time. The effect of the breakdown of the sterilization equipment is that very critical surgeries have had to be postponed by several months, resulting in needless deaths. Are you aware about this situation at the premier teaching hospital of our country?
Thank you, Mr. Chair. This has come to my notice, and I called the Kolebu Chief Executive yesterday. He's given a briefing, and we are finding some support for them to try to see how quickly they can rectify these challenges.
I'd like to find out from you whether you buy into the suggestion that certain departments at the teaching hospitals in our country, such as the neurosurgery department, the urology department, etc., should be granted semi-autonomous status, like the cardiothoracic center, to enhance efficiency in the operation of the teaching hospitals, as opposed to the centralized manner in which some of those departments currently operate.
We are studying the feasibility of that sort of autonomy, and I believe it's something that is workable, because centers of excellence are workable in Kolebu.
Lastly,
you have exhausted your questions.
This is a follow-up.
You yourself,
no,
lastly, very well.
Yes.
Let me save time.
Yes, this is a follow-up to an earlier question asked, and it has to do with human resource development at your ministry. I have been informed that about 113 doctors of medical laboratory science, and my colleague, Honorable Nivandapoy, asked you a series of questions bordering on a medical laboratory science. These doctors have qualified and are waiting to undergo the mandatory housemanship. But
Honorable Agaga, please, was that doctors of medical laboratory what?
Science, laboratory science.
So they are laboratory scientists. Yes. We want to be clear, because on this table we're talking about doctors, talking about nurses. So they are medical laboratory technicians or scientists.
Mr. Chairman, these days they also prefer to be called doctors, and so their designation is as such. The title is MLSD. The D stands for Doctor of Medical Laboratory Science.
Well, that's a degree.
Yes.
It's just like having a PhD in law.
Yes.
Yes, but so that will make you a judge.
Mr. Speaker, when they write correspondence, they use the title doctor.
Yes, they are. But I want us to differentiate between the medical doctor, as in physician or surgeon, or, that's all the difference I wanted to be clear about. So please proceed.
Honorable Chair, the clarification is that lawyers can become doctors in law, philosophers, economists. So we use the title doctor. So medical laboratory scientists have also advanced their education and they are graduating with PhDs. So when they have PhDs, that does not necessarily make them medical officers who are normally called doctors. The pharmacists are now using the PhD, PharmD. So that is how the professions are developing.
Now, this group of professionals have been pursuing your office for assistance to get clearance in order to undertake the mandatory housemanship. What is the position, Honorable Nominee?
I'll have to check on this matter. The various professions are recruited based on vacancies. Some of them are recruited as a cohort after passing the professional exams. So I will check and find out why they are still sitting back and see how best we can get close to them. Tell you, when we are joined, we have recruited quite a lot of them. They themselves are aware. That is the numbers that I was talking about. So we are working.
Very well. Yes, is it Gisela? Yes, you have a question, please go ahead.
Thank you, Mr. Chairman. Congratulations to the nominee as he's being rolled over. I think we can describe it as that. Honorable, what is your, with the advent of COVID and the need to have a regime of preventive health care, a bit much more stronger than we had before, what is going to be your plan going forward on health and wellness for the Ghanaian citizenry?
That is an area we are now highlighting in the ministry. We have done the universal health coverage achievement roadmap, and we have actually highlighted fitness and wellness issues. We will soon launch our non-communicable diseases policy, and you see how we have actually given that importance and significance to that area in health. So when we begin to roll out and implement the newly done national non-communicable diseases policy, you will see how we are going to tackle that area.
Thank you, Mr. Chairman. This is a follow-up question. Don't you think that we are racing against time? Because we all know that the immunity boosters that are needed for COVID, there's a lot of talk about using steam, neem tree steaming fruits, vegetables, and so on and so forth. Don't you think that we should have been doing this at the advent of COVID in March last year, or at least that should have been highly accelerated by now to avoid some people getting into a bit more distress than happens?
If you have been following our COVID education programs, you realize that we continue highlighting exercising and physical fitness. We have instructions to all health facilities to create wellness and fitness centers, even at the district hospitals. And we encourage Keep Fit clubs. I have joined some of them to climb the Abu Hill on 2 occasions. Yes, I did some 15. I can walk very well. Yes. So it's encouraged. We meet with they have a coalition of Keep Fit clubs in the country. They do their annual programs. I join them. So we are doing these things, only that is on a very smaller scale. GIZ has actually helped us to also develop a plan that will enhance developing this area. So like I said, it's a comprehensive package will come out to roll out. But that doesn't mean that we are not doing anything in that area at all.
Thank you, Thank you, Honorable.
Honorable Minister, nominee, and honorable members, please be advised that our center is open. The members who want to join Parliament's Keep Fit can join it. The instructor has just opened the platform and is adding members, so I invite all who wish to join in.
Thank you very much. Honorable nominee, I think I'm trying to emphasize the fact that it should be you are indicating that if I've been following your programs, I think that there should be a bit more to be done about it. And that is what we are advising you to do, because we speak from the districts, from the villages, and so on and so forth. And no, that kind of education is not going on there. NCCA is literally begging for money for fuel to go around with their vehicle. So we know we are racing against time with the COVID. And I would plead with you that you take some advice that we should speed up with some of these things. You can have all your comprehensive plans on paper, but if in reality people are not getting the information ahead of time, some deaths could be preventable. And it may be a bit more, to move with a bit more speed. That would help.
Thank you. I've taken note of that, Honorable Chair.
Thank you. My next question has to do with infrastructure, especially moving from health center status to polyclinic status. In my constituency, the town of Bojuasi, with a voter population of over 18,000, we had a health center which has been upgraded in quotation marks to a polyclinic. But the facilities there will not really, if you really have an inspection of them, you think that they are not really up to the polyclinic status. Be that as it may, there are two doctors there, two doctors who have been posted there. So with a voter population of 86,000, we have only two doctors, two medical doctors. That said, I would like to know what is the policy direction for supporting infrastructure from the health center stage to polyclinic, and who has to fund that? And I'm saying this because there have been a lot of appeal for funds just to be able to construct an emergency center and more administrative space for that facility. And I think that sometimes the appeals, I'm surprised that appeals have to be made that way. I believe that they should have been made from the allocations made from the ministry or so. So I would like to know what is the policy direction on that. Thank you.
Allocations made from the ministry, that is correct. But where allocations are not coming and are not adequate, citizenry are also employed, encouraged to support. Some of us MPs have used our health fund to do clinics in our various constituencies. I say some of us, because others use for other things. This has set up a fence, but it's the state's responsibility. But when it's not forthcoming, we see how best communities and things do. Some communities start their own clinics even before we put in health centers. But you have two doctors. That is why your chief compound has been upgraded to a health center. You have a health center. We have been upgraded to a polyclinic. Most health centers don't have doctors, and you have two. So yours is a peculiar, specific area. Let us see what is not there, and let us see what we can do for that area over the next 3 or 4 years. I'm not maybe even surprised if we won't find your constituency or your districts in the 101. I will have to check on that one.
My constituency is supposed to be in 101. We are waiting. The land is ready.
I mean the 101.
Yes,
if it's there,
we are in there.
So
we are in there. So we are ever waiting for you to come and cut the sword.
Thank you.
In Autu. Thank you very much. My last question goes to, on February 1st, there was a news article about the mortuary workers saying that they believe that the numbers for COVID were not being reported accurately. Their roles are already risky, even in the traditional sense of the word. And now with the advent of COVID, what plans do you have for Mortuary Workers Association?
We are in the process of establishing the Mortuaries and Funerals Act. This was passed some years back. We only picked it last year to try and establish it so that they have an agency that takes care of their welfare and several other things. We have been engaging with their consultant, and I believe going forward we have a program that will help them get some of their challenges resolved.
And then the next question. The sickle cell unit at Kolebu has a database of over 30,000 patients. They see on the average 10,000 patients a year, averagely maybe 50 a day. But it's 45 years old. Over the past 4 years, what intervention did you make in that facility? And what are they going to do moving forward in case you do not make any intervention? Thank you.
specifically for Kolebu on sickle cell, over the last 4 years, we haven't had any significant investments in that area. But we're now engaging with Clinton Foundation. They are coming to do some massive sickle cell program in the country, and I believe Kolebu will be covered.
Thank you very much, Honorable.
I have a follow-up question.
Sorry?
Just one last follow-up question, please.
Oh, you have had one too many.
Yes, they were very short. Thank you very much. Thank you. In our communities, Honorable Nominee, in our communities, we hear a lot of adverts on information centers being played, usually at dawn or in the evening around 6, thereabout p.m. And they're often trying to sell or advertise one medicine or another for a lot of ailments. What is the public health plan for that sector? Because it is very, when I listen to some of the adverts, if I didn't have a little idea, I could be a bit confused about what to buy and what not to buy, because they are very convincing. What steps are you going to take to be able to support and protect the vulnerable in society who listen to all these adverts? I think those on the buses are equally part of that. What steps are you taking to protect those vulnerable groups, to at least know that, or what kind of public health plan do you have in place for that? Because it is a bit one too many. There's a proliferation of information centers. Yes, they're able to earn some money by doing those kind of advertisements, but they market a lot and sell a lot of drugs. Under whose control? Thank you.
We have health committees in all districts. They are supposed to help us fight this sort of battle. The FDA has surveillance activities in the districts as well. And probably what we will do is that we will have to admonish and encourage them to work harder and report some of these matters for investigations. I think going forward, now that we're noticing some of these challenges, we will tackle them head on. And I would say, can I crave your indulgence to stretch a little bit?
Yes, please.
Because at my age, medicine, I shouldn't sit down for more than 3 hours.
Yes.
To try to avoid prostate disorders, but you wouldn't listen to advice.
We will take your advice.
And particularly that your wife is supporting you from behind.
So I'll allow you just 5 minutes, or is it sufficient? Very well.
And refers to references. All right, so it's a prompt therefore. All right. So page 1. Mr. Honorable Nominee, it means 6th September this year, you turn 71, right?
1955. I'll turn 70.
71. And you spent 2 years in Presbyterian Boys Secondary School doing your advanced level certificate.
Honorable Zulera, take note that you're entitled to 3 questions.
This is preliminary. My question.
There's no such thing as preliminary.
Please.
I allow when there's room, but you're spending too much time,
No.
so I'm just guiding you, please.
And then Doma Secondary School, you did 5 years for your GCE. In 1960, you entered primary school. I want to assume that will be lower primary. And then upper primary was 3 years. Upper primary was 2 years. Yeah. I'm a little bit curious about that.
I moved from lower primary to a different school for upper primary. They made me write exams. And after that, they pushed me one ahead. Honestly, in mathematics, I was teaching my seniors. So my teachers were in 2s, and they pushed me up. I was a very brilliant young man.
Excellent. MSLC, Middle School Living Certificate.
Yes.
What was the duration at that time? Was it 4 years or 3 years?
It was 4 years, but I did it in 3 years.
Beautiful. Thank you. Don't worry. Ask your question. Don't mind it. Ask your question. You can go ahead. So now, Mr. Chairman, I want to ask my first substantive question.
Honorable Member, you have had about 6 questions. You call them not substantive.
No problem.
I'm being very charitable because you're a first-time member, but please take 2 more questions then.
You rolled out, you gave us a list of some of the districts that are benefiting from the Eurojet Hospital project. I don't know if you've been to Salaga before.
Salaga, I didn't have the opportunity to visit Salaga.
So, but there's been an Eurojet project ongoing there since 2009.
I'm aware.
And as a substantive minister for 4 years, wouldn't it be curious that you didn't find time to at least visit the project site to acquaint yourself with why the project is delayed so much, what can be done? Because sometimes these field visits actually help to boost the morale of the workers, even the contractor, to know that there is oversight. Would you have any explanation for your inability to visit Salaga?
Yes. I had a plan to tour the entire nation. Prior to the creation of the new constituencies, I was in Northern Region. But the largeness of the region and the time that I allocated took me only to the northeastern part. So when they created a region, it became like I have not visited Northern Region at all because I didn't come to the west side and the Dabon area. So my plan was to have done that last year. Then COVID came. And it's like all my activities in terms of touring the regions actually stopped. Not all the area, but you see, Salaga was part of a package of 7 hospitals. And I was getting reports on the 7 at a go. So that is why I couldn't get to Salaga. But coming on, I get a note. I think I will make Salaga a strong area to go and see what is actually there.
Exactly. I think we need you to...
No, my very good friend comes from that area.
No problem.
Elijah.
All right. So my next question, Mr. Nominee, is what will be your explanation for the recent increase in the COVID infections? And just to take on from where my honorable colleague from Ejiso, what he said earlier on by commending you for sacrificing your life, literally, those were his exact words, to work for this country and to save all of us from COVID. When the incident about your infection came out, we heard different stories about whether you were on leave or you were resting until the president himself told the whole nation on 15th June 2020 that his honorable health minister had contracted COVID. Now, would you say with hindsight that it's a missed opportunity at that time for you to have been an ambassador on the sensitization and advocacy for the COVID instead of trying to sort of at that time hide the status?
I didn't try to do nothing. There was fake news around me. The conversation I had with Efia Pukia was private conversation. I stayed in hospital for only 2 days, and I mentioned that. And jokingly I said, oh, Efia, media no credential danye yario na menyari. Then she went on air and said that this man has been done with COVID. Let me ask you, whoever in this chamber tests positive and goes on air to tell Ghanaians that, advertises that I have tested positive. The first person I reported to was the president, because I needed to take permission. He had to know my situation. We were having several meetings a day, doing stakeholder engagements with professional bodies and all that. And even that, the day I tested positive, I had attended 2 meetings over the weekend before I tested positive on the Monday. So quickly I informed them that go and test Alan Chamatin and the guys who were doing the manifesto at the time. Go and test the people I met in Alisa, right? And I hinted the president's medical officer, because on the Sunday I was with the president. And they did all these tests. What I didn't do is to come on air and announce that I have got COVID. But I think that wasn't my domain. 2 days in hospital. The 3rd day when I had a chat with the Efia Pukia, I left the facility. Then they reported that my wife was on ventilator when she was never positive. And that was one of the wonders. I said, the woman I'm sleeping with, I test positive and she never gets positive. Right? Then my children have tested positive, which was all fake news. So I didn't want to dwell on this propaganda on air. But when the president, I told him and I said, you can go ahead and announce it to clear the mischief that people are trying to do around me. He did so for me, and I think that was so. Thank you. But openly, I've admitted several times, and even since that, I've done several tests, to try to ensure that I don't get positive again.
Yeah, Mr. Nominee.
Thank you very much, Honorable.
I have a supplementary question.
Honorable, I've given you so much space. You've asked so many questions.
Honorable Nominee just made a very important point that I want.
Well, you spent all the time on matters which you didn't consider important. Now that you have, well, I'll give you one more.
Okay. So you just said that, fortunately, Mrs. didn't get the infection. Now, some of our medical friends have said to us that little children, it's very difficult. They never will not show signs and symptoms of the COVID, even if they have it. How do you tie that in with reopening schools where children are going to school? They could come home, contract COVID, come home and not show any symptoms. But what they can do is to infect the adults in the household. What will be your position on such a dilemma in terms of policy?
That is a possibility. And I wouldn't say no, it is real. But there are certain things we cannot run away from. We closed schools for nearly 1.5 years. Children were getting bored and tired at school. Even in the midst of COVID, we started easing. You couldn't lock down the country for how long? And so all other places, and we said that we would learn to live with the disease. It was good for us to try to experiment to see what it is. And we opened schools earlier on. Senior high school children went to school without so much challenges. Right, the few little ones that we got, we saw the problems. Tertiary students went and solved their problems. And it took us time to actually decide to send young people into schools. So the disease, like I said, scientists across the globe still are not very sure, don't know the true characteristics and nature of the disease. So it's like we're experimenting and researching day by day. And it looks like we need to do something to run our economy to survive. And so we couldn't keep children at home forever. That is why we did this. But we are trying to ensure that the commodities they need to try to protect themselves and adhere to the protocols are all there. Parents have been educated. Some are getting trained in the schools to try to ensure that children are well protected. So if you come in and you see any symptoms, the only advice is that try and get to a doctor as quickly as possible. Let us test and see if you have got the disease and treat you. So that is the challenge that we have, but we have to confront it head on.
Very well. Now leadership.
Thank you, Mr. Speaker. Mr. Chairman. Mr. Chairman, I want to find out from the nominee, in answering an earlier question, he talked about the bonds. The bond that was used in defraying the debt of health insurance. And Mr. Nominee, did I hear you say 400 million bond was issued?
No, I think I was specific and said that I'm not very, very sure. I have to check on it.
Okay, but you are sure about the use of bond to clear the debt?
Yes, yes. But that is a debt instrument owned by Minister of Finance. We were looking for the money that they should have given us. They didn't have cash on hand. They arranged to find cash for us using that bond as an instrument to procure that facility for us.
I want to refer you to the Health Insurance Act, source of money for the fund. That's section 41. Chairman, with your permission, I read. The sources of money for the funds are A, National Health Insurance Levy provided for under section 47. B, 2 1/2 percentage points of each person's contribution to the basic National Social Security Scheme, that's SNIT. C, monies that are approved for the fund by Parliament. D, monies that accrue to the fund from investment made by the authority. E, grant, donation, gift, and other voluntary contribution made to the fund. F, fees charged by the authority in the performance of its function. G, contributions made by members of the scheme. And H, monies accrue under section 198 of Insurance Act 2006 Act 724. Mr. Minister, nowhere in this act that says that you could use bond to clear the debt or run the funds. How do you juxtapose the law against your admittance that you use bond to clear the debt at the health insurance?
Honorable Chair, we have always relied on monies that have been approved by Parliament through finance to be given to health insurance. I don't remember health insurance raised the bonds in their own name, with their own title, with their own authority. The bond was done by Minister of Finance to give us the cash that was due us. So health insurance didn't raise the bonds, it was raised by finance. And I want to even suspect that finance came to Parliament to seek approval. If not, that is the problem for finance. But if you lay this as a question to me in health, it will be difficult for me to actually allude to this. What I know is the fact that this was raised by finance to give us cash. We didn't raise it.
Are you sure finance got parliamentary approval for that?
I wouldn't be able to say this. I was just looking for money to clear our debts.
That you were only interested in the money without necessarily looking at where the money is coming from?
Oh, Honorable, yes.
Okay, let's just move on.
You see, there was pressure. Pharmacists who have served drugs, doctors, we are owing. I have got a mandate. I pledged that I will clear the arrears, and it's accumulating again. Honorable, you know, you are on the health committee.
Yeah, I continue to be on the health committee.
Somebody is bringing you money, you go and ask him where did you find the money.
Earlier in your answer to the Frontier Health Care Services Limited at the Kotoka International Airport, did I hear you say that that services was procured by the Presidential Task Force on COVID?
Yes, I did say so.
Are you a member of the Presidential Task Force on COVID?
Yes.
So if you are a member of the Presidential Task Force and you were going through this contract, are you saying that you didn't know the details of the contract that was being given out or that was being done?
Honorable Chair, the Presidential Task Force was actually started by me from the ministry, the early stages of the onslaught. I said I was creating an Ministerial committee. But then the first two meetings I called, my colleagues wouldn't come. So I told the president that he should take over that interministerial committee to enable us to engage. And that created the Presidential Task Force. Okay. They're in the task force, a very large thing.
I don't dispute that. I mean, whilst the task force was going to embark on an health
we had
project.
separate functions for separate groupings and committees within the task force.
And are you telling this committee?
And there was created a
Minister, if you let us have a conversation that those listening to us and we in the committee can follow, it will be useful. And you are telling this committee that as a Minister for Health then, and they were procuring a health service at the airport, you were not in the known.
Yes.
Is the Presidential Task Force on COVID an entity?
Where entity means?
Where they can procure. Because you know it's only an entity that can procure. You've been the former chair of the Public Accounts Committee.
No.
So how did they procure if they were not an entity?
They did that in collaboration with Ghana Health Service.
So are you then suggesting that it was Ghana Health Service that front the procurement of this service at the airport?
To interrogate that matter.
When you say you interrogate, what does that mean?
I'm not very privy to the initial stages of procurement. When I got, they finished arrangements with it, and they came to my notice. I was more interested in getting the facility set up and providing port health officials to man the facility. That is when I came in. I didn't go back to interrogate these matters to the extent that you want me to answer. And that is why I'm saying that I have to get back to interrogate.
Okay. Earlier you also said that this group didn't even have a license. You have to encourage them to go and register. Is that right? Yeah, so when they were registering, did you bother to find out their nationality?
No, please.
And after subsequently, when they were operating and there was a lot of press conferences and noise by Ghanaians or protests or complaints by Ghanaians, as the health minister, did you pay attention to the press conference or the complaints that Ghanaians were making with regards to their operations at the airport?
Yes, I did. And that has resulted in the reduction of the fees for at least ECOWAS citizens.
And you didn't pay attention to how they were operating?
So I didn't pay attention to how they were operating, that will not be correct. What I say that I didn't interrogate the processes for procurement.
No, but you were paying attention to how they were operating.
Yes, definitely. The training of port health people, culminating even in the intention to create a proper port health division in Ghana Health Service. They were all part of the things that we did to enable us get people to man the place. So I paid attention.
So is that company operating in a laboratory in this country that you know?
Please, I cannot answer that question. I wouldn't know their facilities in the system. I don't know.
Minister, you said you paid attention to their operations. And
at the airport. Yeah, and I wouldn't know if they owe Akai or Medilab or any other facility in the country.
If you paid attention to your operation, they were taking samples to test. I thought that it would be natural for you to be sure where are they doing this testing. They were taking samples.
They have set up equipment in the airport, their own imported PCR equipments and antigen equipments to do the testing at the airport. They don't carry the samples to any facility in this country.
You are telling this committee that they were doing the testing at the airport. This is another information you are giving us now.
Yes, to the best of my knowledge.
Honorable Minister, do you know that that company belongs to a Nigerian?
Please, I don't.
Do you know that it was registered only in July, ahead of the opening of our borders in August?
Please, I don't.
Mr. Chairman, in his earlier answer to a question, he said that when the President talked about 88 hospitals, the President was talking about his vision. And this vision, that was to be translated into action. Is that right, Minister?
Yes.
So what briefing were you giving to the President prior to his announcement that the commencement will start in July?
Your question again?
Because I'm saying that what briefing did you give to the President before his announcement in July that the commencement will start in July?
The President assigned tasks, set up a committee, and admonished us to work hard to to ensure that we could commence at least in July.
And you gave him your word that that was doable?
Not only me, the entire committee.
And have you been able to start any?
At the moment, no.
So you give the president assurance that by July, he can go ahead and tell Ghanaians that by July, the hospitals will start. And now you are almost 9 months after, or 8 months after you gave the president that word, and he told the whole of this country, not a single one has started. And you said that you advise, the rest of you advise the president to make this pronouncement.
I said the committee, not me.
But you chair the committee.
I don't chair that committee.
Who chairs that committee?
The Chief of Staff. The Chief of Staff.
The Chief of Staff, but you are the Health Minister, and the Chief of Staff will be relying on you as the
President sets up a committee, appoints the Chief of Staff as chair, and the Health Minister will go and tell the President that make me chairman.
Mr. Chairman, I want to find out from the nominee, was he anywhere around June 2020 at the birthday of the CEO of Health Insurance Authority?
Yes.
Do you remember that around that June there were restrictions on the number, on gatherings, parties, churches, mosques?
Yes.
And as the Minister for Health, you were in a birthday party.
It was a restricted, seriously restricted engagement.
How many
I wouldn't call it a party.
How many
number
people
there were less than 10. And I think the restrictions, these gatherings were allowed.
Mr. Minister, were you sure you were less than 10 or around 10 people who were in that party?
I'm very sure. If you have any other number, I wouldn't know where you got the number from.
Mr. Chairman, I want to find out, earlier in an answer to a question about the Procurement Authority that occurred, he said there were a lot of confusion about the politics of Antisnake venom. Is that right? Is that what you said?
I didn't mention the word confusion. I said I started thinking that there was some politics around the procurement of anti-snake venom.
What was this politics about?
There was a petition. I called the Procurement Authority to come and do audit around the process, to give me a report. It takes 3 weeks to get a report done. In the process, Ghana Health Service Director General secures sole sourcing approval to procure the same vaccines, which wasn't in the procurement plan of Ghana Health Service. There was no budget for Ghana Health Service to do that. We tried to go through the framework contracting window to try to procure these vaccines because the procurement process will have been asked to terminate it and stop it. Again, Central Tender Review Committee disallows that one to go ahead. And I was getting frustrated. That is why I'm saying that these processes were the type of politics I talked about.
Did you really get briefing on the tender processes before maybe you spoke on Adum FM during this challenge?
What do you mean by go briefings? I studied the procurement documents, and that is why I invited the Procurement Authority to come and do a procurement audit on the process.
Okay, so you studied the procurement documents and all the process that had gone through before you invited the Procurement Authority?
Yes.
Do you remember that in that procurement document, one of the things that was found fault of the process was change in tender prices?
That was part of the report that I got.
The
explanation I got was that they were not changing. The procurement process allows them to do corrections on some of the tender documents that they have brought. But that is what they explained that they did. They didn't change any price.
But did the procurement process also reveal that there was double bidding?
I got to know from the evaluation report. The company that has registered in country also has principals outside the country where he imports the vaccine from. And so that company bidded, and the registered Ghanaian company also bidded. And that is what culminated into that situation.
And you were also told that the bidders were not registered with FDA, Food and Drugs Authority, an agency under you.
I didn't get that information. It looks like all those who bidded had registered with Food and Drugs Authority.
No, that was part of the report you got from PPA, why they said the two companies, Pharmanova Export Private Limited and Pharmanova Limited, should not be allowed to participate in any procurement at the Ministry of Health. Is that not right?
That is not right. I met Pharmanova in the ministry supplying drugs and vaccines. The first one they made me sign in 2017 was done by Pharmanova from Vince. FDA reports indicated that that vaccine was the best anti-snake venom we can get to the country and the cheapest.
But the procurement authority, together with the central tender, all then agreed that these two companies were virtually one and same, and the very anti-snake venom that they were trying to import, they were not registered representative through FDA in Ghana.
Sorry, I didn't read that in any report. You can find for from FDA that company has got the product registered in this country. If there's any other product that also registered, it couldn't be that from Vince.
Why did you cancel the tender against the advice of the PPA?
What tender did I cancel? They asked us to do re-evaluation. I assembled pharmacists through Ghana Health Service facilities across the country, expanded the evaluation committee, and they did that. After they have completed, before we could go ahead, that is when Ghana Health Service had secured sole source authority to procure, and they had imported. And we're going to use the budget that we're going to use to do this procurement to pay for that one. So I just couldn't have any budget to continue the process. And I informed, PPE as such.
So you finally gave Kina Pharma the contract to supply the anti-snake venom.
It was the second best evaluated company after the evaluation.
So you didn't cancel the tender?
We did a revaluation. We got the product. But what we did was that we didn't have any budget. And I was looking frantically for some budget to do the work. When we found money, he couldn't give us the amount we wanted to give. So we slashed down the quantities and asked him to provide what we have budget to pay.
Did you also realize that based on the PPA evaluation, where they said one of the reasons why they disqualified the earlier companies was that they were not registered representative of the foreign company. Kina Pharma was then not also a representative of Inosan Biopharma SA. Were you aware?
You used the word was not then.
When you gave them the contract to supply the anti-snake venom, one of the reasons why the earlier companies were cancelled were still affecting this one, but you went ahead to allow them to pick the contract and supply the anti-snake venom.
I don't think that was the situation.
Do you remember the loan of 73 million by World Bank that was meant for maternal and child health projects?
Yes,
that was
I do.
secured by your ministry?
Yes, I do.
Why was part of it used to settle claims of health insurance authority?
I wouldn't be able to answer this question.
Why? Because you are the Minister for Health.
Let me come, honorable colleague. I inherited the ministry and I started looking at our finances. And I asked them to give me a report on the maternal health project that was being funded by the EU. At the first presentation, what I realized was that there was a big hole of 79 million Ghana cedi points into donor funds. So I had a problem with how I can respond to audit queries by EU. That happened before I got to the ministry. So I went there to do firefighting. I informed the Minister for Finance about this matter, including Danish ambassadors' money, the MAC funds. And so we have to find a way to replace that money. They gave me goods and services a little bit bulky in 2017 after the March budget. And we used some to start paying for equipment that the previous government had contracted to be brought in because the EU money had got finished. So that is what we used to try to pay back the EU money to get the program running. So if I
Chairman,
can tell
so
you why,
did you use the money, Chairman, with your indulgence, did you use the money other than the purpose for which the loan is approved? And borrowing from your public accounts lexicon, will that qualify as misappropriation without violence? Thank you.
Honorable colleague, if you ask me, you are being unfair to me. Let me use that harsh word. I inherited a problem that I tried to solve. That is all. To save the face of the country.
Made it clear. The money had been used for purpose other than it was said before you came to the ministry.
Exactly. I can give you a history. 2016, goods and services allocation to the ministry was virtually zero. They didn't give them money in the budget. So that was what the former chief director and the directors in the ministry, including the minister then, who I inherited, used even to run the ministry. That is what created the gap. And when I saw this...
we are not disputing that. That yes. Fall within the lexicon of the word you use when you were chairman of public accounts.
No.
Will that qualify as misappropriation?
Yes, definitely. Misapplication, not misappropriation.
Misapplication.
If you say misappropriation, it means that you have chopped the money.
But if you chop it wrongly...
No, that is misapplication. Instead of building a hospital in
to borrow your whip, sorry, thank you.
You have bought a car to do something else. That is misapplication. So they actually used it. And I tried to save the face of the country with our donors. So I asked finance to find us money to repay. And in accounting, when you misapply money, you have to refund. And I tried to do that. So we got money to pay the suppliers who had been awarded contracts before I got into the ministry in 2017.
So you are telling us that
praise me for doing that.
The loan agreement of the $73 million US have been refunded.
I wouldn't be privy to the refund because these loans are serviced by Minister of Finance.
No, I'm not talking about repayment. I'm talking about the way you yourself said, oh yes, you admitted that you apply part of it to do other things. But then you managed to get Minister of Finance.
For the record, he did not apply.
It means it's me. And I don't want to accept that it is me. So let's use a different lexicon. Not me, Honorable Muntaka.
Well, the Minister of Health.
Or the former minister.
Minister of Health, maybe let me say, since you don't want it to be personalized.
That is a better phrase.
Yeah, because you know at public accounts, when you are dealing with ministries, nobody goes to talk about, oh, those who were there. The chief director today and the minister today, they answer at public accounts as though they are answering for the ministry. I mean, and you were chairman of the public accounts. But for just not to take us back, the ministry between 2017 and 2020 had used part of this 73 million to help pay claims at health insurance authority. Is that right?
That is all right. The money was spent before 2017.
The monies were spent before 2017?
Yes.
That's for a fact.
Yes.
I just want to find out from you, who is Nicholas Jabba at the Ministry of Health?
Nicholas works as the head of Multilaterals.
Has he worked at the Ministry of Health before?
He's worked there for 4 years now. I took him from Minister of Finance on secondment to the Ministry of Health.
And he handles all the bilateral and multilateral funds?
He handles multilaterals with the PPME. He's serving under the director of PPME. So he has a unit that he heads.
And handles the global fund projects?
Yes. Let me correct an impression. Global fund projects are handled in the Ghana Health Service by control managers. When I got into the ministry, there was a big problem. Engagement between the ministry and Global Fund was zero. So Ghana Health Service was dealing directly with Global Fund. Meanwhile, when Global Fund gets audit queries, they will bring it to the minister to resolve them. When they're looking for certain reports, they will send letters to me to resolve. Then I looked at the Global Fund package, huge amount of money. They have structured the system such that the money doesn't even pass to Minister of Finance. So it comes to the Ministry of Health, and everything is transferred to Ghana Health Service. And you were sitting in the middle as a minister. So I needed to create a system that will have an insight into what is happening with Global Fund money, because I was fed up with audit queries that was coming. The first one I read was something that nobody would want to actually see. So I brought in this young man from finance to come and sit there and look at how we can build a bridge between the ministry and Ghana Health Service, so far as Global Fund reporting and the management of their funds is concerned. That is how come I brought him there.
So when was he seconded from Minister of Finance to Minister of Health?
2017.
And he handles proposals on your behalf?
What proposals?
Proposals that are supposed to come to the minister. He handles them on your behalf.
I don't understand. Several proposals come to the minister. He cannot handle all proposals. So specifically, he doesn't handle any proposal. He sits as somebody who links with Global Fund and other multilaterals to support the minister in terms of demands from me, reporting, and what we should submit to them. And then I ask him to find out how monies are being spent and finds me reports to actually satisfy my curiosity.
So is that all he handles at the Minister of Finance?
It's not the only thing. Global Fund procurements and things that they bring to us, and Gavi or our vaccines, they have to go through the exemption window. So he actually processes documentation and submits to Minister of Finance, follows them up for us to get the exemptions. When I joined there were vaccines that were sitting at the port. Some of them will go several days and weeks without any attention. So he has also been doing that on behalf of the ministry. He packages all the documentation and answers all questions the Minister of Finance will do to give us exemption to be able to clear these products or commodities for use.
So even though it's not a signatory to any of your accounts, but are you aware that without his okay, no payment is done at your ministry with regards to these funds?
I instructed him to do so because of the money they misapplied. And I wanted somebody to have a look at it, said that we wouldn't get audit queries unnecessarily.
Have you had complaints of unnecessary delay as a result of his work?
I've had complaints, but I've explained that people are resistant to change, including all of us sitting here. So when you introduce a new system that is biting on what benefits some people were having, there will be challenges with it. Thank you.
Are you aware your contract workers and the Global Fund have not been paid for about 4 months as a result of his action?
That is not his action. I'm very much aware of these challenges. Why would they be paid? They did something without Global Fund approval. Exchange fluctuation happens, and then you go and pay them on new currency rates. When in the agreement with Global Fund, that wasn't the case. Then Global Fund asked you to refund the monies, and you said no. I asked my chief director, Nicholas, to negotiate and tell Global Fund that because we are in the COVID situation, we are getting close to elections, to the end of the year. They should wait until after the year, and then we will start making the deductions from their salaries. Before that, Global Fund has put an embargo on their salaries until they pay back what they owe them. So it isn't Nicholas who delayed those salaries. Please.
Okay. Mr. Chairman, I want to find out from the nominee, the ambulances that we procured, over 300 of them, whether they are insured.
This is a difficult question. I have to check on this. There were instructions for insurance to be done, and I have to check on it, Minister. Sorry. Honorable Chair.
So, Mr. Minister, they've been in the system for approximately almost 10 months or more. 10 months or more. And, Minister, you are not sure whether they are insured and they are running on our streets.
That is the case.
The health workers and the Frontline, when COVID became severe, were to be insured, right?
Yes, Honorable Chair.
And you took steps to insure them?
Yes, Honorable Chair.
Which company is the insurance company?
A consortium of about 10 companies. 10 insurance companies. We use the broker,
so
and the broker actually syndicated the companies for us.
So can you name them?
Off head, no, but I can remember Enterprise, and I think SIC. I need to get a list properly.
Did you go through tender to procure these insurance companies?
Heat of the pandemic. Even World Bank waived tender processes and asked us to facilitate funds to move faster. So I'm afraid we didn't go through that tender thing.
But you know, our procurement laws allows for emergencies and how to deal with them so that you will not be seen breaching our procurement laws.
I asked my procurement unit to seek approval for sole sourcing or selective tendering from the PPA, and I want to believe that was done. In the heat of the pandemic, honorable colleague, if you were me...
Are you saying for sure that you did go through the PPA even under those emergencies where there's a clear provisions where you can fast-track the process and get it done, or you are just saying that you are not sure?
To the best of my knowledge, we triggered the emergency procurement window in the PPA Act, and almost all the things that we're doing, right, we have sought approval before we do them. Some even go, depending on the amount involved, go to a central tender review committee. We have been very cautious about that.
And do you know that you went ahead to procure these services before even informing Parliament?
Which services?
The insurance for the health workers.
Well, yes, honorable. We were not obliged to come to Parliament to seek approval to go and underwrite insurance for our health workers.
Are you on time in payment to these health workers? Because you know some of them have lost their life online. Some who have provided those services.
No.
Why? What is the problem? Because
we asked the service providers to submit lists of those who have been affected and those who have died and all that. This we sent to the insurance broker to negotiate with the principals to give us reliefs on that. We submitted...
Chairman, just pardon me, but I'll take it as part of my... In an answer to the question posed by the Honorable Muntaka, you just indicated that you are not obliged to come to Parliament. Now, nobody anticipated COVID. Did you have budget for it, and how were you going to get appropriation for what he asked? Thank you.
I think the Minister for Finance sought approval from Parliament to give us funds to do what we have done so far.
That was what I was saying. You procured the services even before the Minister of Finance came to seek approval to spend on those items.
Thank you for giving me that information.
I'm only asking you, I'm not giving information. Honorable Minister, the Upper West Regional Hospital, since 2019, when it was open for operations, had not received any seed money. Is there any reason for not receiving seed money up to now?
There is a reason. Remember, Upper West Regional Hospital is one of the Eurojet projects packaged during President Komfort's time, 7 of them. When I came, virtually work has stopped on all of them, and through to my commitment assurance to this committee and Parliament, I had to move to get things done. When they were packaging in the procurement process, they didn't put in any amount as seed money for the project. We only got to know this after we have commissioned, and then the doctors that went in there started asking for seed money to come. We have had challenges with finance in giving us any seed money. What I've done now is that any new procurement thing we're doing for hospital construction, we have to build in a budget line for seed money, such that when they start, they can work with it. But that's notwithstanding, in the onslaught of COVID, we have given virtually these facilities we have designated treatment centers some amount of money to be able to run the facilities, and we continue to support them.
Are you aware, or has it come to your notice that for 18 months, health insurance has not paid them their claims? The same Upper West Regional Hospital.
This hasn't come to my notice yet. For health insurance, like I said, the information that I have is that they have paid up to August. And when they tell me this, it means that all facilities. So there's one particular facility like this that has not been paid. they should petition me, and I'll follow up to try to find out. But honestly, this hasn't come to my notice yet.
You know, as a CSM, it's one of our major challenge, and I want to find out from you what is your plan for this year, so that we don't get there and we will lose lives unnecessarily.
My colleague, when we started getting information of the few ones that have come up, even this year, I sent a team to go and visit the places to look at it. I have some sort of quantitative report template that I have here, that I visited almost all the, districts in Upper West, together with the Regional Director for Health Services, and they work together with their health services that I have here. The numbers that I have here, week 5, through the districts is 4, week 51 is 4, 52 is 3, and all that, up to when they started coming up from week 1 going. So the numbers that we have are not very significant yet, but we have taken notice of it, and we are working up there to look at it. The problem we have with meningitis now, Honorable colleague, remember last year, I had to come to the chamber to brief Parliament on the outbreak of meningitis. The variants that we are getting on meningitis now in Ghana don't seem to have any vaccine on the globe. So those days when we will go and vaccinate against meningitis during the season, these days we don't have the vaccine. So what we have to do is public education, to try to advocate that you try to do things that will not necessarily bring the outbreak. Don't sleep together in hot areas at the same time and things like that. And that public education has started ongoing in the Western region, the Upper West region. Chairman, thank you.
Mr. Chairman, the Minister, the use of the National Health Insurance Fund to pay for nurses' allowance. Minister.
Pay for nurses' allowance?
Yes, nurses' allowance using the health insurance fund.
Honorable colleague, let me explain to you. When we're restoring the nurse training allowances and the teacher training allowances, I opted that they should transfer the budget for health training allowances to health insurance. And my thinking was that we could pay to the students easier because health insurance has got district offices closer to the health training institutions. When we started, it didn't work. So eventually we have to switch on to U-Switch. So monies are now transferred to U-Switch, and the U-Switch transfers directly to the, students. So we haven't used health insurance money to pay students' allowances at any point.
Minister, you lead your budget hearing at the committee, and the budget documents are there. Apart from the capping, you use the fund to pay for, and the allocation is there, unless you want us to go into the details of the budget. And it's not money that are brought in there, but the fund allocations are made as part of the fund in the budget for.
Honorable Chair, I have to interrogate this again. Remember, Honorable colleague, you have sat on the health committee for a very long time. You know there is Ministerial.
I thought you've also been at the ministry for a long time.
Oh, only 4 years. You have been there for nearly 12 years.
I've been there for 16 years.
Look at you. Now, Honorable Chair, you know that there is an allocation for Minister of Health in the Health Insurance Fund disbursement package. We use that to buy vaccines, we do several other things. If that has happened, it might be that the 10% cap to support Minister of Health might be what one have used. But that one, I still even have to check, because we get budget allocations from finance specifically for these training allowances. So it's something that is making me a bit amazed, surprised. I'll have to check on
my
that.
last question. Nose masks for kids. Interestingly, because kids have to go to school, all of a sudden the cost of nose masks for children is very exorbitant, more expensive than that of the adults. And Minister, as you know, even though I know you will say, oh, why not wait when the education minister comes, you ask him. Because it's related to health, and consequences of failure to use nose masks will fall under your feet. What do you think we can do to make sure that at least if we can provide for every kid, we'll ensure that the cost is not so exorbitant to
to disenable parents from procuring for their children to be able to go to school?
Thank you, Honorable Chair. Honorable Chair, the Minister of Education quantified these PPEs before reopening of school. The quantification report came to us a bit late. And Ministry of Trade, having identified the companies that sold the masks, actually allocated to the companies to do the sewing. They have to design special ones for kids that has smaller sizes to fit their faces. And even that caused a little bit of delay in actually shipping the face masks and things that were going to the north. It delayed about a week or two after school reopened. So parents haven't been asked to actually procure compulsorily for their kids. They can support, but what we are doing is being paid for by the state. I can't remember the price, I think 4 cedis or so, but that is being paid for distribution to all the children. So special ones that are being sold outside, I'm afraid I wouldn't even want to know the price, and I don't know how I can control those prices. The most important thing is government PPEs for children. The type of size that we are sewing, get to them as frequently and as quickly as possible.
Very well. Honorable Leader.
Honorable Minister-designate, 2 years ago, some waiver was given, which waiver enabled local pharmaceutical companies to get a platform to produce some other drugs that otherwise were imported. In effect, there was some restriction on some drugs being imported. Will you consider, in view of this waiver, a value chain effect in terms of packaging so that our local printing companies do benefit?
Thank you, Honorable colleague. The pharmacists who benefited from this package continue to petition, and we work closely with them. We try to listen to their concerns, and this is an area that we're exploring. You know, some of these exemptions, especially on packages, for example, will have what we call economics, some externalities. You know, the material is not used for only packaging drugs. So immediately you bring the rates down. It can affect several other packaging areas that the finance ministry will not be comfortable with. But we are engaging. So if it becomes feasible that we extend that over to that area and it will be acceptable to the Minister of Finance, we will not hesitate at all to so do.
Honorable, I think perhaps I need to properly situate the question. You see, some restrictions have been placed on importation of some drugs. Your colleague, the then Trade Minister, came to announce it on the House floor. My point here is that these pharmaceutical companies now having that space to produce these drugs locally, meaning we no more allow importation of these. These locally produced drugs are labeled. I am saying that instead of they having to import these labels from China and India, we need to also look at value chain effects to create employment and all that. Would you want to consider that arrangement to also impress on them to rely on our local printing companies? Because Assembly Press is there. They have very sophisticated machinery, equipment, graphic communications. They are doing so well. Would you consider making such a strong suggestion to them?
Honorable, I don't understand your plea. I think I also do. I also do.
You also do. Thank you so much. That's a good commitment. Now,
sorry, you use the harsh word commitment. No,
yes, if you so do. Records, I mean, once you are committed, I'm happy.
Then let me withdraw. I also do.
Oh, because it's good for our local
economy. The efforts to engage them.
Employment creation. So I'm happy you are committed to taking this up. Yes.
Okay, I'm committed to take it up.
You don't need to run away from this commitment.
I will take it up.
Yes. The local printing firms will be happy with you.
So that next time I wouldn't be facing questions like, you made assurances, you did this. That is why.
Very well, no problem. Honorable, you see, Mr. Chair, the Ghana Health Service has its own entity head, correct?
That's correct.
And you don't supervise that entity head, do you?
I'm supposed to supervise that entity head.
But he's independent in terms of...
it's independent in terms of operations.
That's correct.
When it comes to policy, the ministry does it.
That's correct. So that's correct. So you wouldn't be privy to operational decisions regarding procurement between the Ghana Health Services and another entity.
The Ghana Health Services has its own procurement unit. They do their own procurement to that records to the ministry.
Very well. So was this your suggestion when you had said that when it came to the issue of testing at the airport, it wasn't your ministry that directly handled it, and possibly it was an arrangement between Ghana Health Services and the task force?
Honorable Chair, I think I mentioned that.
Just for emphasis, that is why.
Yes. Then I'll emphasize.
Yes,
so collaboration
because if it is the Ghana Health Service, obviously you can be the entity head.
Yes.
I just wanted for emphasis.
I must say, the Director General for Ghana Health Services, Dr. Abuaji, was involved in that area.
Now, my colleague Honorable Ablakwa had made a statement on the House floor regarding this testing at the airport, raised the cost, and among others also raised an alarm that the entity is not even registered in Ghana. The entity is not registered in Ghana. This afternoon, Honorable Muntaka has said that the entity is a registered entity in Ghana, except that he qualified it by saying the ownership is... yes, that's what
the Honorable Muntaka.
He said it is owned by a Nigerian.
I just speak to the record. What one of our colleagues there referred to the regulatory authority and mentioned that at the time that the entity was in place, it hadn't been licensed by the National Health Regulatory Authority. That is my understanding.
Chairman, my name has been mentioned. If I can clarify.
Honourable members, please.
My name, the Honourable Deputy Leader has mentioned my name directly.
Hello. Yes. Now, what is the question you want to ask the Minister? What do you want him to answer to?
Honorable Minister-designate, if I got you correctly, the entity that is doing the testing at the airport was a registered entity at the time it engaged in the exercise at the airport.
Honorable Chair, I told you that I wasn't very much privy to the procurement processes at the initial stages. So as to the documentation or registration of the company in Ghana or anywhere, I won't be able to answer these questions. Probably those in Ghana Health Service who collaborated with a small group within the task force to do that will be able to answer. It looks like they use the Ghana Health Service and procurement unit. It looks like, but I'm not very sure. So these things will have to be interrogated elsewhere and away from this forum.
Now, the
company that is doing the testing at the airport, would you agree with me that it doesn't need to have a laboratory outside of the airport to have the capacity to do what it's doing at the airport?
Definitely, yes. That was how the whole structure was framed. They wanted to do testing within 10 or 15 minutes for people to exit the airport. So they were supposed to the airport for the testing.
And is it your case that the services they provide at the airport is the first of its kind, and no prior domestic experience is required?
It's the first of its kind domestically, even globally. When they started that process, a few people who came through, foreigners, and visited the ministry, testified to that the structure we have here, they have traveled across Europe and across America, they have never seen it. So ours was a bit unique.
Now, would you consider a negotiation that would lead to a further reduction? Because you informed the committee that ECOWAS citizens are having some rebate now. I am concerned. Could you possibly look at?
We are still looking at it, but now that ECOWAS has adopted, and it's going to be a common thing across the continent, the sub-region, our negotiations may reduce it in Ghana, and it may also affect the ECOWAS community. But you see, what escalated the price after my first interrogation was the cost build-up that they tried to explain. And then we said, okay, but then with complaints and people were forwarding and not that, the president insisted that let us continue to engage them. And that came down to accept the $50 that is being done across the sub-region.
So, to the best of your knowledge, the services they provide at the airport doesn't come at a cost to government of Ghana.
It's a partnership. They provided equipment, and then we provided the health staff, I think. And I think security is also provided by us. So the facility is owned by them, the entire infrastructure, the equipment and everything. And we provide personnel to man them after their training.
So they are not charging government of Ghana for any services?
Into them at all.
The charges, if you say partnership, does that mean that they do profit sharing with Ghana Airport Company? You are also providing them with a space. Is there a profit sharing or some revenue come to government? Because Ghanaians would want to.
I may have to interrogate this area as well.
Whether they are paying.
I have to see the agreement and things like that before I'll be able to answer these questions.
Very well. Thank you so much.
Honorable Ranking Member.
Chairman, I should thank you for the opportunity that the nominee is a returnee minister to the Ministry of Health. And just for the record, whilst he was appreciating himself and what government has done, it's important that you appreciated that part of the serene labor environment is the fact that the previous administration of John Mahama and ourselves gave to the Ghana Health Service, and particularly health workers, the first ever codified conditions of service, and that has contributed to normalcy and some industrial peace and harmony. It is also, Chairman, not too factual when the minister says that there was no financial clearance in the past. There was. In fact, October and November 2016, which we inherited, there was 9,500 of nurses recruited by a letter signed then by Honorable Setekpe. It is also to be noted that the Public Financial Management Act also, because it's a meeting of record, provided that negotiations of public service workers, including health workers, be completed before budget. So it's made it better in terms of payroll and wage salary management, that within the year you are not likely to have any hitches because these matters would have been conclusive before budget. My first question is, have you seen a copy of the contract with Frontiers Healthcare Services Limited charging the $150 per person as part of the COVID testing? Have you cited a copy?
Honorable Chair, I haven't seen it, please.
Chairman would request that a copy be made available to us. Do you know how the 150 charge was determined?
Hold on. Who would make the copy available to you? He says he has not seen it. He has not cited it. So it would not be fair to ask him to produce it. So
but who should produce? His health minister when it happened. Yeah. He was health minister when the agreement was signed.
But
I would insist that it's him who can provide us.
Without due deference, we will discuss this as other thing, that when a witness has not admitted that he holds a copy, you cannot ask him to produce it.
So, Chairman, then, Chairman, let's write formally to the Presidential Task Force on COVID to make available to this committee relevant
let's
documents.
Proceed with the examination of the witness. These extraneous matters about...
Chairman, it's not extraneous.
No, when he puts a document in, if you find that there's a procurement breach, he says, I was not part of it. So you cannot hold him to that.
But unless in Ghana, he is our Minister for Health. Who do I hold responsible?
You can accuse him of not doing his work, but don't ask him to bring a document he's not a part of. Let's not be doing this argument here. But please.
So who has responsibility for COVID and its management in Ghana? So, Chairman, we request that the Presidential Task Force is formally written to make available to this committee the contract of Frontiers Healthcare Services Limited, which is charging that arbitrary $150, not approved by our fees and charges regime as a country, and was arbitrarily determined. We need it going forward. Minister, has noted that poor hygiene and sanitation remains a major challenge of health delivery in Ghana. What will you do to address that?
Honorable Chair, I think we are addressing this issue. You finished the question.
Chairman,
why should we wait?
Frontline health workers who have been assisting you fight COVID to combat and contain COVID, when was the last time they were paid their deserved allowances?
Honorable Chair, I must admit that there have been some delays to some portions of these frontline workers. We set up a system that was soliciting data from the facilities. And on my last check last week, looks like finance queried the numbers that were coming. So the facility managers were asked to review the type of list that they have brought.
Are you aware that that can affect morale and delivery? If you work for 4-6 months, you are not paid your allowance?
I believe if the monies haven't been paid, today is Wednesday, we send them, they brought some of these.
Those for which validation have been done, when will they be paid their allowances?
I expect by close of this week. Monies will have been released and they may have been paid.
The UK Academy of Health Sciences talks about the new threat of future health, what they call multi-morbidity. What steps are you taking for the country Ghana to contain people with simultaneous diseases?
This is not a new phenomenon in this country. We have people with comorbidities and we are treating them. So the service provision that we are doing will cater for these. They keep on bringing out challenges that we have at our annual health summits, and we revise our plans to try to tackle some of these things. So the same strategies that we are using, we learn from the emergency portion sections of the Act.
Do you share the view that teaching hospitals be granted autonomy and that outpayment in order to relieve government of some burden?
I do agree. I do agree.
How do you intend to undertake that if you are confirmed as Minister for Health?
We have to tread cautiously. We already have started engaging. Kolebu submitted a proposal, and I cautioned. Already they collect IGFs. That doesn't come to the national level. They utilize the IGFs to do their work, give them extra funds. So my fear is that if you are not careful, and we grant them that autonomy and severe them, the entire health system at that high level is likely to break down. Even this afternoon, yesterday, when the Chief Executive of Kolebu came to me, Minister, our oxygen situation, Minister, this is our equipment, Minister, this. And I keep on, when I meet the Chief Executive of the hospitals, that if any finance minister looks at the type of IGFs that we are generating, you will have insurance, at least, he may not give you any extra allocation to fund anything. So there's a bit of a problem, and that is what I intend to
officially publish palliative healthcare policy in Ghana.
I don't mind, I will say no.
What do you intend to do about it to support palliative healthcare in Ghana, and when?
Healthcare, some part of it has been captured in the small area of the non-communicable diseases policy of palliation.
There are shortages of critical care nurses in Ghana. What do you intend to do about it in some facilities, including the Kolebu Teaching Hospital?
Between last year and now, we have put in close to about 90 nurses to upgrade their skills into critical care. Yesterday, I was confronted with a situation where some of them haven't been able to pay their fees, and the principal is trying to even increase the fees, and I drew his attention to the Fees and Levies Act and asked him to suspend until we engage properly. So we are increasing them, and we are designating some of the schools to begin to do diploma in critical care nurses so that we can increase the numbers. But we are looking for support to see if we can actually give them scholarships or sponsorships so that we can facilitate the speeding up of these nurses in the system.
In an answer to an earlier question posed by the Honorable Swain and subsequently by the Honorable Muntaka, you referred to for maneuver. Yes, they have a reputation for snake vaccines or that particular medication you referred to. But the difficulty of Honorable Swain and Honorable Muntaka is that you, as minister, ignore admonitions from the Central Tender Board and the Public Procurement Board on the procurement process leading to the determination of killer farmer. It's silent. And that the procurement rules were strictly adhered. Yes, please. Were there changes in the figures as submitted on the day of tender and subsequent award of contract?
When the problem arose, I said here that I invited the procurement authority to come and do audit and guide me through the processes. So I was following the guidance that they gave me. They asked me to do evaluation, which we did.
By the same of you, the date raised objections of you proceeding further. How do we reconcile that?
I don't know which days you are talking about. Because after the reevaluation, that was when we should have awarded.
There was a letter signed March 26, 2019, signed by then Chief Executive APA, PPA ordered the health minister to disqualify. Did you cite that correspondence?
Disqualify who?
In that letter, former Nova Export Private Limited of India and former Nova Limited of Ghana, on the basis of the tender, have said that I can speak to their reputation for snake vaccines.
And subsequent to this letter, I've used a document that has awarded that contract to Salaga.
Honorable, I will normally you don't ask the question, just answer.
I'm sorry, but I'm being a little bit curious.
HIV, hepatitis B, and others, what plans do you have to make medication for them affordable to Ghanaians affected by it?
We are getting support from global funds so far as HIV and TB is concerned, including malaria. So they give us money based on agreements that we underwrite with them. It's a donor funding based in Geneva. They support us, but we do co-funding in terms of medication, and we rely on government And I think this
said that the National Health Insurance Scheme was probably in coma. Did you inherit a scheme which was in coma?
But I would say my simple answer is yes, but I don't want to sound political.
It's years when you had other countries coming to understand the Ghana's health insurance system has been the most efficient and effective.
Definitely, the system that we set up, including myself, I was one of the foundation chief executive of health insurance. Attracted very many people, far earlier than the period that we are talking about. But that doesn't mean that our health insurance that I inherited wasn't collapsing. Honestly, we go 12 months in arrears, facilities were charging quietly in their facilities, and patients were not benefiting from health insurance at all. We only have a structure that was paying people with little amounts of money that they get for their salaries. But down there, the facilities, this wasn't happening.
I described the nature of the coma of the NHIA you inherited. What was the nature of
we're owing 12 months in arrears.
As of today, how much does the National Health Insurance owe? And in more effectively on the 400 months,
effectively between 2 to 3 months. We have paid up progress on our budget. Between August and now, let me say February end, it's about 5 months. But the law, we have states as the lead time 3 months to provide this to allow them to submit their claims and raise the bets. So if you look at it very critically, effectively, we owe only 2 months.
as Minister, you probably may have perused the handing over notes of the National Health Insurance Authority. What is their outstanding liabilities?
Honorable colleague, for me to remember of it. These numbers are so many.
Will you make that available to this committee so that we understand the extent to which areas have been cleared or the extent to which areas have been accumulated?
To it. Honorable, I can give the updates from health insurance, and I think it's the paper I can lay.
And from which countries? Your mid-March target?
We are expecting some limited amount of about 355,000.
Population of how many Ghanaians?
We've got a population of an estimated 20 million Ghanaians. That is
two shots gives you what quantity?
40 million. And we are making arrangements to cover the entire 40 million within some period of time.
What particular medication are we looking at? Is it the one coming from the US or from South Africa or from Europe?
The medication is coming from Europe now, AstraZeneca. The Pfizer one, we don't have the cold chain infrastructure to bring it because of the ultra-zero temperatures that we should store the commodity in. So we are zooming on AstraZeneca. But the good news is that towards the Gavi arm, and then the AU has actually set up the African. The fact that Gavi, for example, using this, the hope is that there are a lot more potential candidates that are coming. Johnson & Johnson, for example, in the next few weeks, they get certification. Sputnik, they get certifications. Like I said earlier, the president is calling bilateral diplomatic levels to try to ensure that we get some of these commodities as quickly as we can.
The challenge of sustainable health insurance financing in Ghana in the last decade, including yesterday of your own supervised health insurance, is one of funding. You have hinted at premium to make it sustainable. You want to share your numbers with this committee?
No, I don't think I'm in a position to do that yet. We did some calculations far earlier, around 3 years ago, but we couldn't progress it to come to
pass. I want to share any actual findings and studies, recommendations with our committee.
These numbers are difficult for me to do. I don't want to come and tell you 10, then tomorrow it's 5, and then I have a problem. So when I haven't seriously prepared into that area, I don't have documents.
Are you suggesting that the 2.5% VAT plus that pension premium may not be enough to adequately finance that into the future?
I've told you earlier on that is not adequate. That is not adequate. If we get something extra, there's a lot of insurance can do.
Will you attribute that to population increase in terms of people have insurance and government not complementing it with adequate financial releases to the Ministry of Health?
Not only population increases, but cost escalations in terms of medications and equipment and devices, and even the skills that provide these services. If you are paying for doctors and that is being covered by this.
Chairman, I want to tease the nominee's mind. There's an important Supreme Court ruling. I'll get the record for this committee on the public account and may I respectively refer you to Article 187 of the Constitution against the Supreme Court ruling that the Auditor General has the powers to surcharge even before Parliament as an institution as required by Article 187 examines the report so submitted to us. What is your view on it? And Chairman, I quote Article 187, the preceding financial year to which each of the accounts mentioned in clause 2 of this article relates, submit his report to Parliament and shall in that report draw attention to any irregularities in the accounts audited and to any other matter which in his opinion ought to be brought to the notice of Parliament. Then Chairman 6R, Parliament shall debate the report of the Auditor General and appoint where necessary in the functions under the Constitution. So emphasis the 6 Williams of Public Accounts. The Supreme Court has passed a ruling saying that Auditor General can even proceed ahead of Parliament. Do you find anything professionally or legally wrong with that?
Honorable Chair, you are soliciting my opinion on this matter.
Well, you're not bound to give it.
I'm not bound to give this opinion. Perhaps I decline to actually respond to this question.
What's the status of the Bolgatanga Teaching Hospital?
Honorable Chair, Bolgatanga Teaching Hospital has faced a hiccup. The project is supposed to be done with donor funding from the Saudis. And I must say, one of the disappointments that I've had is funds from that area. They delay and delay and delay. I remember when I pushed and pushed, there was indication of them having restored that money to come to us. I went to Bolga and promised, just like you do when you go to Tamale. You know. Then I came back and I said, we'll finish in September. When it started, they are money to do the equipment, the procurement for the equipment. You send them your pay.
As part of the President's initiative, one regional hospital, you are sure that people of this completed. They have done procurement and they have to approve. No objection is gone. And for nearly 3-5 months now, they haven't got it. In the elections, I was trying away from going to Bolga because you asked me questions. Why is it operating now? We had initial challenges with electricity connection. There are still uncompleted structures as you drive by the airstrip looking at it, which are medical facilities. What are you doing about it?
Medical facilities, we may have to. It's not part of the facility itself. The contractor has sent it over to us. We've done commissioning, we've looked at everything. With the other facilities we can add on, I think we may have to look at it again and plan to incorporate that facility.
Specialized training for medical professionals and